Hello, good morning, everyone. Apologies for the 5 minutes of delay. So we'll be starting over now. Hi, everyone. My name is Purban, and thank you, everyone, for joining today's event of World Sight Day celebration with Optometrist Association Tripura and Eye Supervision. So in this event, we'll be having it's a mixed event. We'll be having like cultural event, educational, knowledge sharing things and all everything. And we have a pioneer optometrist from different part of the world. We have optometrists from Pakistan, Bangladesh, and India as well. And the main focus is on will be on the students here, and we have so many students from the different part of India and other part of the world also. So I'll be starting my presentation. Just give me a couple of minutes. Okay, is the screen visible? Can I see anything on the chat? Okay, so yeah, we'll start. So I'll start with the portfolio of eye supervision. So basically, eye supervision is a eye care organization which is founded on 22nd of January 2020. So the main mission was to eradicate the avoidable blindness in the world. And we also strive to provide comprehensive eye care solutions and also empower the optometrists and the future optometrists who are currently studying with our two different wings, which is Eye Supervision Academy and Eye Supervision Foundation. So we also have our head of the Department of Optometry, Abranil Chakraborty, who handle the Eye Supervision Academy. And like he will be briefing you about that one. And the main research, aims of the eye supervision is these are 10 main goals of eye supervision. We do research, we do education and training division. We do community outreach care, and we also have an like experience center in the office in Tripura. So there we do innovation and technology, we do knowledge sharing and all. We are also in teleoptometry, and we also ensure that the quality is perfectly maintained. We also do patient support and counseling. Uh, there are also public health initiatives. So we do eye awareness camps and eye camps in the rural areas also. And we are also in vision rehabilitation, where we also empower the visually impaired person to do something. So it is like eye care is something. If someone do not have their eyes, so it's like they cannot do their work. As for example, if someone is as for example me only, if I am visually impaired from tomorrow, I'll not be able to work. So it is like it is impacting my like earning thing. So it is a financial problem. So we also empower that the person with the visually impaired, they also get trained in some way so that they are not financially downhill. We also do corporate partnership and fundraising programs. Uh, so this is our Eye Supervision Academy, which is dedicated to education and training for the optometrist, which Abranil will be providing you about the more the details what we're doing in Eye Supervision Academy. So I'll be skipping this one for now. And these are the Eye Supervision Academies. What are the courses we provide and all? What are the research and developments and we do in this? And we have our expert faculties also here. So yeah, the main function is Eye Supervision Foundation. So the foundation is the humanitarian arm here, which where we work as an NGO to like the main goal is to reach the people who are in tier 4 and tier 3 and more rural, like hyper rural areas. Um, just a second. Yeah. So we also do eye screening camps. We do medical assistant program. We also do community engagement programs. We do workshops and all eye awareness, and we also like collaborate with other healthcare providers like physiotherapists and laboratories thing and all. And we do other works also, and we also collaborate with corporates. We do CSR programs and all. So this is our few works where which we did in past couple of months in the rural areas of Tripura with our team. Yeah, these are the works. We also maintain the data is collected well, and the main goal is like people do eye screening camps, but the main issue is like after the screening camps, nothing is done. Screening after screening, like it's like they're getting free medicines, they're getting spectacles. The people who need surgical interventions and who also need some vision therapy, contact lenses, or the specialty care. So these people, like other people, don't touch them. So we do all those stuffs. So in this recent camps, we provided free medicines. We provided few free spectacles also, and we are also doing the cataract surgeries for the people who have the Ayushman Bharat card and all those stuffs. So yeah, we are also open for volunteers from all around the world. Maybe you can scan this QR code. Maybe you can take a snap. Uh, and currently we are taking volunteers till 31st of December 2023. So anyone who is willing to join the voluntary program of Eye Supervision Foundation can come with us. So this is our team of core team where Mr. Sabraj Saha, Mr. Debanjay, Avranil, and Poshali is there, who is managing. Currently, Shamrat is the general manager, and Debanjay is handling all the administrative parts. Avranil is the head of the Department of Optometry, and Poshali is the content manager. We also have our quality faculty team where we have Miss Anamika Acharji, which all of them are the junior optometry faculties, and we have Miss Pooja Rudrapal and we have Miss Anamika Rudrapal. We also have Miss Nanika Chanda and Miss Tanushree Majumdar. So yeah, you can join our vision. So maybe you can note down the website and mobile number also. Maybe you can take a snap. You can join our program. Also, it is not like that. It's all about foundation. You can also come as a volunteer in academy as a faculty also. So that's all from my side. Thank you. So, and I will be handing over to Mr. Abranil, will be uh, providing you the detailed information on Eye Supervision Academy. So Abranil, up to you. Thank you. Abranil, can you share the screen? You are on mute, Abranil. Can you please unmute? Abdul, are you connected? Okay, we'll move next. Maybe we'll accommodate Abdul in the later stage of the event. So maybe you can start with Tanushree will be uh, doing a song for us, and will be the cultural event will start. So Tanushree, up to you. Okay, sorry, Tanushree. Tanushree, can you unmute?
Hello, can you hear?
Please.
Hello. Can I audible, all of you?
Yes, Tanushree, you're audible. Please go ahead.
Can I start?
Thank you, Tanushree. A big round hand of applause for you. So we'll go to Mr. Abranil. So he's ready, I think, now. Abranil, yeah, so we'll start.
Good morning, everyone. After this wonderful song from Tanushree, we'll continue with about our iSupervision Academy PPT. So now I will share the screen. So, good morning, everyone. So today I'll represent a PPT on our iSupervision Academy. I am Obronil Chakravarti. I am currently HOD of iSupervision Academy. So that our aim of our academy, iSuper Academy, is to dedicated for providing quality education and training for optometrist and eye care profession. Our academy is an education and research academy. Its main goal to bring out quality optometrist, to create a well-educated optometrist who can treat the patient as a worship of God. And here we have also our experienced faculties in their fields. You can see our faculty members like Anamika Acharji and Miss Pooja Rudropal, Anamika Rudropal, and Miss Nainika Chanda and Tanushree Majumdar. They are very dedicated faculties who are expertise in their fields, and they have vast knowledge in optometry subjects and other also research purposes. So after this, here some I will share some. You can see some PPTs that only our online sessions of masterclass, which was done by in our eye supervision academy on the topic of eye care and sport. And also we have done one classes in last week or last month, I think, on online sessions of our academy. Like we have teaching the students here anatomy and physiologies and other subjects of first year students. And also we have our experience centers in which we mainly give the experience, new experience in using new things for it. And it is open to all, and we open to all optometry students. And we can here gather experience about the new things, and also some things we here use, like we have glasses, contact lenses, and other things. So that's all, and thank you. And I like to say that today we are celebrating the World Sight Day. So on that occasion, uh, that what is the main theme we have, like that, love your eyes at work. So we'll try to keep our eyes healthy and do whatever necessary, and we should also
Obrinal, your
focus on.
voice is low. Maybe can you put the mic?
Oh, sorry,
Yeah.
sorry, Abdul. So our main aim should be like that. If without eyes we cannot see the anything, so with that slogan and also the theme of our today's World Sight Day, that love your eyes at work, we should keep maintain that and also help others. As an optometrist, our main duty is to create awareness and counsel them for better treatment and purposes. That's all. Thank you, everyone, for my side. That thank you, everyone.
Thank
Now
you.
I'll hand.
Thank you so much, Obrinal. So I'd like to add few things on academy. So any students who are studying in first year, second year, third year, fourth year can come to our academy. Currently, we have our academy only in Tripura, our main experience center. So anyone from Tripura who's studying in, so there is a couple of medical, paramedical colleges who provide optometry in Tripura. So maybe you can come over here and be an academy member, and you are all open to join. So we'll go next with the event. So we have Anamika Acharji, who will give a speech. So Anamika, over to you. Yeah.
Hello.
Yeah,
Am I
you are
audible?
audible, Anamika. Please start.
Okay. Good morning, all the delegates out here, to respective faculty members, seniors and juniors. My name is Anamika Acharji. I am currently pursuing Bachelor of Optometry in second year in Tripura Institute of Paramedical Sciences, which is under Tripura Central University, and I am Junior Optometry Faculty of Eye Supervision Academy. Thank you so much for having me here today, and I am here to deliver a speech on the topic of awareness and prevention about cataract. The eyes are the windows to the soul, but when cataracts cloud the glass, the view can quite be hazy. The cataract is a cloudy area that forms on the lens of the eyes, leading to blurry or dim vision. A cataract can significantly impair our vision if we leave it untreated. When the lens develop cataract, the cloudy change in the lens reduce and vision and causes the image projected onto the retina to be blurred. Some steps for prevention of cataract: wear sunglasses that block 100% of UVA and UVB rays, shield to our eyes from harmful UV radiation. Consume a diet with rich antioxidants, including fruit and vegetables. Manage our blood sugar levels effectively, as control diabetes, because diabetes is associated with the high risk factor of cataract. Obesity has been linked to an increased risk factor of cataract. So avoid obesity, maintain a healthy weight through diet or exercise. Schedule routine eye checkup. Every year, 3.8 million people lose their eyesight due to cataract. So it is very important to aware about cataract. Some key points for cataract awareness, like educate people about the risk factors such as age, UV exposure, smoking, cataract, then certain medication condition like diabetes. Aware people about the common symptoms like blurring of vision, difficulty seeing at night. Highlights how cataract can affect daily activities like reading, driving. stress the importance of regular eye examination, especially for those over 60, to detect cataracts early. Inform the individual that cataract can be surgically removed and replace lenses can restore cataract vision. In conclusion, I would like to say that cataracts are one of the most common eye condition among people over 40 years old. Preventing cataract primarily involves lifestyle choice and protective measures. Globally, June is observed as Cataract Awareness Month. Cataract awareness about is essential to ensure to understand the condition, its symptoms, and the importance to early detection and treatment. Thank you.
Thank you so much, Anamika. It was a very, really, very knowledgeable thing which you have shared. So we'll move to the next part of the event when Nayanika will be giving us a speech. So Nayanika, please, over to you. Just a second. So can you turn on the video, Nayanika? Yeah. Please go ahead.
Good morning, all delegates out here to respective faculty members, senior and juniors. My name is Nayanika Chanda. I am currently pursuing a Bachelor of Optometry in second year in Tripura Institute of Paramedical Science, which is under Tripura Central University. I am a junior optometry faculty of Eye Supervision Academy. And today I am presenting a speech on Love Your Eye at Work. Love Your Eye at Work is about helping the people understand the importance of protecting their vision in the workplace and calling on business leaders to prioritize the eye health of workers everywhere. With the help of our global partners, members, we aim to show the world how important it is. No matter where you are or what job you do, it is important to prioritize and protect your eye health at work. It's included everywhere from avoiding accidents in the workplace, which are too often caused by or lead to the poor vision, to productivity, which is greatly improved when eye health of worker is made priority. Thank you. Have a nice day.
Thank you, Nayanika. Okay, so can you have Miss Anamika Rudropal for this? Okay, so Pooja is doing, right? Sorry, Anamika Rudropal will be delivering a speech. So Anamika, to you. And one more thing, guys, who are there in YouTube and in Zoom, would like to tell you, please join on Zoom because the questions which will be taken for the panelist will only be from Zoom. Not from YouTube because we are delayed a couple of minutes in YouTube. And one more thing is that there is a quiz competition and also essay competition announcement. So please be on the event. So Anamika, so please go ahead. You are on mute. Yeah. Anamika, you can start. Anamika, can you start? Like any issues? Okay, just a second. I've already allowed you. Can you turn on the video? Anamika? Yeah, you can now unmute yourself. Please say.
Yes. Now audible. Now you are audible.
Yeah, you're audible.
Good morning, all the delegates out here, respected all the faculty members, my seniors and my juniors. I am Anamika Rudrapal, currently pursuing Bachelor of Optometry second year, which is under Tripura Central University. I am also junior optometry faculty of Eye Supervision Academy. Today I am here to talk about the role of artificial intelligence in the management of eye health. Our eyes are not just the windows to our soul, but also to our overall well-being. They are one of the most precious gifts we possess. With the advent of AI, we are witnessing a revolution in eye care that promises to change the way we manage and protect our vision. Artificial intelligence has made remarkable strides in the field of healthcare, and eye management is no exception. AI potential is far-reaching from from early diagnosis to personalized treatment plans, making eye care more accessible, efficient, and accurate than ever before. One of the most significant contributions of AI in eye management is early diagnosis. AI-powered algorithms can analyze retinal scans and identify conditions like diabetic retinopathy, glaucoma, and macular degeneration far earlier than traditional methods. Furthermore, AI can facilitate remote eye care. Telemedicine powered by AI can enable individuals in remote or understand areas to receive expert eye consultation without the need to travel long distances. The technology can analyze a patient medical history, genetics, and lifestyle to create a tailor-made approach to eye care. It'll also help in managing chronic eye condition for patients with diseases like glaucoma, which require constant monitoring. AI can provide real-time data and alerts to both doctors and patients. In conclusion, the integration of artificial intelligence in eye management is a game changer. It is reshaping the way we diagnose, treat, and manage eye condition. AI is improving the quality of life for countries, individuals. Together, we can work towards a world where the gift of sight is preserved and protected with the help of artificial intelligence. Thank you, everyone.
Thank you, Anamika. It was a very knowledgeable thing. Thank you for sharing. So we have a very interesting thing now from one of our academy student. I'll just share that. So we have a very beautiful artwork by one of our academy student who is Miss Paramita Mitra. So she's currently studying in first year of optometry in Tripura Institute of Paramedical Sciences. So Paramita, can you unmute yourself, and would you like to tell anything about this artwork? Just a second. Can you please turn on your video so that I can unmute you? Okay, yeah, you can unmute yourself now. If anything you want to add about this, you can add. It was a really very great work. I want to see the comments in the chat section. So if anyone want to tell anything. So Paramita, up to you.
Good morning, and present. I am Parmita Mitra. Currently, I am pursuing my Bachelor of Applied degree from the Institute of Paramedical Sciences. Painting is my first and favorite hobby. The picture I draw made two important points. Our eyes, the most precious divine gift of life. Beside this, they have the witness both our good and worst experience in our life. We always capture each and every moment in our surrounding through them. And so today I am representing the night sight beauty through eyes. Most of visualize the night with fair. So there's also a cool and authentic view of that night. Therefore, I painted a picture through which we experienced both scary and beautiful view of night. Thank you.
Thank you so much, Paramita. Okay, so now we will have just a second, Miss Pooja Rudrapal. Okay, so Pooja, can you please turn on your video? Yeah, so yeah, you can unmute yourself now. So Pooja will be doing a recitation. So yeah, please start.
Okay. Can you hear all?
Yes, you're audible. Please start.
Okay. Good morning to my all delegates and my respective faculties and my seniors and juniors. A program has been organized on the occasion of World Sight Day by Eye Supervision Academy. Currently, I am pursuing Bachelor of Optometry in second year at Tripura Institute of Paramedical Sciences, which is under at Tripura Central University. And I am also the juniors optometry faculty of Eye Supervision Academy. First of all, thank you for giving me this opportunity to talk here. A small effort of mine is reciting a small poem. Poem name is कुछ करना है तो डरना क्या, कुछ करना है तो डट कर चल, कुछ करना है तो डट कर चल, थोड़ा दुनिया से हट कर चल, लिख कर तो सभी चल लेते हैं, लिख कर तो सभी चल लेते हैं, कभी इतिहास को पलट कर चल, बिना काम के मुकाम कैसा, बिना काम के मुकाम कैसा, मेहनत के दाम कैसा, जब तक ना हासिल हो मंजिल, जब तक ना हासिल हो मंजिल, तो राह में आराम कैसा, अर्जुना सा निशाना रख, अर्जुना सा निशाना रख, मन में ना कोई बहाना रहे, लक्ष्य सामने है, बस उसी पे अपना ठिकाना रख, सोच मत साकार कर, अपने कर्मों से प्यार कर, मिलेगा तेरी मेहनत का फल, किसी और का ना इंतजार कर, जो चले थे अकेले, जो चले थे अकेले, उनके पीछे आज मिले हैं, जो करते रहे इंतजार उनकी, जिंदगी में आज भी झमेले हैं, जिंदगी में आज भी झमेले हैं. Thank you.
Sorry, thank you so much, Pooja. It was really very beautiful recitation. Okay, so now the last speech of the first half will be done by Miss Paushali Dash. So Paushali, up to you.
Good morning to all the delegate here, respected faculty, my juniors and my seniors. I am Paushali Dash, the content manager of iSupervision, and I am also a junior faculty of iSupervision Academy. Recently, I am pursuing optometry in Tripura Institute of Paramedical Sciences, which is under the Tripura Central University. Firstly, thank you everyone for giving me an opportunity to represent my view about tips for eye health care. Ladies and gentlemen, on this World Sight Day, I want to emphasize the importance of taking care of our eyes, our windows to the world. Here are some valuable tips for maintaining good eye health. First one is regular eye checkup. Schedule regular eye examination with an optometrist or ophthalmologist to detect any potential issues early on. Next one is diet balance. Ensure a diet in antioxidants, vitamins, and minerals, especially foods like carrots, leafy greens, and fish, which are beneficial for your eyes. Next one is protective eyewear. When engaging to activity that could pose risks to your eyes, such as sports, construction work, or even using a computer for extended period, wear protective eyewear. Next one is reduce screen time. Follow the 20-20-20 rule. Every 20 minutes, take a 20-second break and look at something 20 feet away. 2. Reduce every strain when working on digital screens. Another one is accurate sleep. Get enough accurate sleep to allow your eyes to rest and rejuvenate during the risks of eye fatigue and dryness. Another one is proper lighting. Ensure good lighting when reading or working to reduce eye strain. Avoid glare and excessive brightness. Another one is quit smoking. Smoking is linked to several eye diseases, so quitting can signify improve your eye health. Another one is hydration. Stay well hydrated to prevent dry eyes. Drinking plenty of water through the day. Another one is UV protection. Use sunglasses that block harmful UV rays to protect your eyes from sun damage. Another one is manage health condition. Keep chronic health condition like diabetes and hypertension under control as they can affect your eyes. Next one is hygiene. Practice good hygiene by washing your hand before touching your eyes to prevent infection. Another one is eye exercise. Perform simple eye exercise to strengthen eye muscle and enhance focus. Another one is limit alcohol. Excessive alcohol consumption can control to eye issues. Consume alcohol in moderation. Next one is stay active. Regular physical activity promote overall health, include eye health. Last one is reduce stress. Stress can contribute to eye strain. Practice stress reduce technique like meditation or yoga. In conclusion, our eyes are precious and maintaining their health is essential for overall well-being. By following these tips, you can keep protective steps to safeguard your vision and enjoy a lifetime of good eye health. Let's commit to cherishing and caring of your eyes, not just on World Sight Day, but every day. Thank you.
Thank you. Thank you so much. It was a very wonderful tips for eye care. So now we'll be moving to the interesting part of the event, which is the panel discussion. So we'll start within a couple of minutes. So yeah, we have the panel one of today's, and before that, I'd like to tell everyone who are watching on YouTube, you please come to Zoom for asking the questions, and who are already in the Zoom, please be ready with your questions. So we have our panelist, Mr. Shashank Painuli, who is the assistant optometrist and ocularist of LV Prasad Eye Institute. He is also a fellow of LV Prasad Eye Institute, and also did his master's in optometry. Next, we have Miss Menka Sharma, who is the founder of Optometry Pathshala. And she is also currently working as a consultant in All India Institute of Medical Sciences, AIIMS, New Delhi. She did her Master of Optometry. Next, we have Mr. Prashanjit Das. He is currently working as an assistant professor in Dr. B.C. Roy College of Academy of Professional Courses, Durgapur. He did Masters of Optometry, and he was also the ex-assistant professor of ITM University, Gwalior. Next, we have Ms. Ratna Shaha, who is currently store manager of Titan Eye Plus Bangalore. She did Bachelor's of Optometry from Tripura Central University, and she is also an ex-employee of Lenskart. Next, we have me, so I'll skip this part. And next, we have Mr. Samrat Shaha, who is the general manager and also the project manager for eye supervision and currently pursuing optometry. He'll be the co-moderator and I'll be the moderator. So we can start the panel discussion. Just a second, I'll just spotlight everyone.
Hello everyone.
Hello, Menka. How are you?
I'm good. नमस्ते, कैसे हैं सभी लोग?
अच्छे हैं।
It's very
Hello
good
everyone.
to see you.
अच्छे हैं।
And hello, am I audible, Apurbayan?
Yes, you are audible, Prasanjit.
Okay. So hello everyone and hi, myself Prasanjit, and thank you to see you all of you again here in a platform and giving me the chance for speaking about my expertise topics. And again, thank you to Apurbayan and the Eye Supervision Academy. How are you, Menaka? Is everything
I'm
fine?
good, sir. कैसे हैं आप?
Okay.
Thank you so much for inviting me.
It's all credit goes to the yes, Eye Supervision Academy.
Samrat, yes. So this is the first event. We are a bit low equipped on the technical things, so it will take 1 or 2 minutes of time. Ratna, are you here? Can you just turn on the video so that I can put you on spotlight? Ratna, are you here?
1 second, I'm here. There's a thing
Sure,
is I'm
sure.
not able to connect the video.
No problem. I'll just wanted to feel. I lost you, Ratna. Can you please turn on your mic? So maybe she's rejoining. Okay, we'll wait. First of all, I want to tell one thing. There is one dedicated panelist out here, Mr. Prashidit Da, who is currently traveling. He's in train, but still here joined us.
Yeah, thank you, Purbayan. Actually, the problem is that here, when I have changed my state from Bihar to Patna or in Northeast, so like network also we change
I
here.
understand. Understand.
And that is the main issue actually. Okay, not an issue, it's fine.
Ratna, are you here? I'm not getting you. Okay, we'll start. Okay, okay. Okay, Menka is also joining from the conference. Okay, Ratna is having some glitch on the camera. No problem. So we'll start. Okay, so everyone, please be ready with your questions. So we'll have a 40-minute of discussion, and after that, we'll have 20 minutes of question and answer. Okay, so please, we'll start. So can each panelist I have already given the introduction, so people will also want to hear from you. So please, I'll ask everyone to give your introduction. And the main topic here is career path in optometry. So everyone is student here, so which will be helpful for them also. Please, I'll start with.
Yeah.
Okay, Ratna,
Okay, you go ahead.
Yeah,
I
you're
thought I
audible.
will start.
Yeah. Okay. So we'll start with Menka.
Hello everyone, I'm Inka Sharma. मैं founder of Optometry Pathshala and working AIMS New Delhi. And I think बाकी सब आप मेरे बारे में जानते हैं.
She's also doing a great initiative of Optometry Pathshala. So there she provide educational thing to students. So it's a very good initiative. Shashank, can we have your introduction?
Yeah, hi. Good afternoon now because it's 12 o'clock. Thank you so much for being here. And thank you, iSupervision and Apogan. My name is Shashank and am I audible, right?
Yeah, you're audible, but a bit, I want a bit more clearer.
Not clear now?
Yeah, it's better. Maybe if you can put your headphones, it will be more better. Okay, you can start.
Yeah, hi. My name is Shashank and I completed my bachelor's in 2014 from SRH University, Dehradun. Then I completed my ocularist and oculoplasty fellowship from Medical Prasad in 2016. And then I completed my master's from IT in 2020. And currently I'm doing I'm a consultant optometrist and ocularist at LV Prasad Institute, Vizag. This is just a short introduction.
Thank you so much. Can you have the introduction for Mr. Prasidha also?
Okay, so myself Prasenjit Das, and I completed my bachelor's in Institute of Paramedical Science in 2014. After that, I joined like teleophthalmology project, as you know, that Tripura Vision Center. Then after that, I switched my job to Chaudhary Eye Hospital Research Center, Senior Optometrist, and from joined like ITM MIT University for my masters, and previously I was associated with Gwalior also, academic coordinator, exam coordinator, and the internship coordinator also. Currently, I am associated with Dr. V.C. Rai Engineering College Academy of Professional Courses as a assistant professor as well as the exam coordinator also. So internship coordinator also, and associated with few of the research also. So that was a brief like introduction about me. I think
Thank you, Mr. Prasenjit. Can we have also the introduction for Ms. Ratna Saha?
Yeah, hi, good afternoon, everyone. I'm very sorry, actually. I don't know why my camera is
No
not
problem,
like, I'm not able to connect the camera. So like, thank you everyone for joining in the live session, and I thank you, Apurva, who is my classmate only, to like arrange a like wonderful live session. So yeah, my name is Ratna Shah. I'm a graduate from like Tripura Institute of Paramedical Sciences. I think our juniors are also there in the live session. So like I have like graduated from Tripura University only in 2020. From then, I have been working with Lenskart. After that, I have joined Titan. Now I'm a store manager of Titan in Bangalore, and I have been managing like 3 to 4 stores at a time together. That's all about me.
Thank you so much. So we'll start with the questions. I want to go with everyone. So it's a general question for everyone. So what are the challenges everyone here face? So we have like panelists from different expertise here. We have faculties, we have a clinician, we have a like founder. We also have a like a retail dispensing field also. So like what are the challenges like everyone you have faced in the education in optometry, and like how did you overcome those challenges? So it's an open question. Anyone can take this and can answer. Am I audible?
Yes.
Yeah. Like anyone can answer this. It's an open question to everyone. So anyone want to take that?
Apurva, can you repeat this question again, please?
So I'm just asking, what are the challenges you faced during your education in optometry, and like and how you overcome those challenges to be where you are today?
Yeah, I want to say that, am I audible now?
Yeah, you're audible.
Yeah. Challenges, see, when so this question is very nice. So challenges, every one of us has to face the challenges in each and every day of our life. And
your sound is a bit low, Shashank.
1 second.
Yeah, headphones will be better.
Is it fine now?
Yes, super clear.
Yeah. So challenges each one of us has to face each and every day. But the main challenge which I feel like that, which I have to say, is that see, when we were studying in our bachelor's, so I have studied from like Dehradun. So there the standards are different as compared to the other states. Okay, so when I came to LVP in 2015. So that was a main challenge for me, like that coming from the state where the optometry is good there, but the things that we used to do over there are totally different from what we used to do in LVPI Hyderabad. So that was a main challenge, like learning new things, learning the new diagnostics things, new ocular history, and about the most of the disease. And also that was a main challenge, which I have to say that was a main challenge for me actually at that time. Although each and every day is a challenge in each and every specialty wherever we are working, that was the thing which I want to say.
I want to add something actually. Go ahead, Prasenjit, go ahead.
Okay. So two of the challenges is I faced during my career is, first of all, people are not aware about the optometrists. I think till so far in as we are in 2023, maximum people are think that what is the optometrist, and that they are not differentiated between the optician, optometrist, and the ophthalmologist. What is the main task? Also, they think it's a technician course, and this is the, I think, most serious issue for our country. Like, people are not aware what is the function of an optometrist, what is the work culture, and what is the career of an optometrist. And next one is the that I have faced during my academics time, and till so far I have facing that few universities and colleges are allowed
Okay.
about the environment, but according to the NAP rules, like few of the universities are open nowadays, you can opt optometry course without science or PCM or PCB. It is also one type of challenge recently I have faced, because they are.
I think he got disconnected. Okay, Ratna, you can start.
Yeah, the same thing I was supposed to tell, what like Prasenjit Da was telling. So what mostly, if you can see, people like students like us, what they used to do, like they will think about like optometry is a course which people will get to know after 12th only. For me also, when I was on 12, like in 12, so I got to know about optometry after 12th only. So the thing is, for like what I want to like tell everyone over there with the call, you should start telling about everyone, no matter like it's like in for elder peoples only, or for the peoples who are studying in school or colleges, you should tell them what is optometry. So in that case, what will happen? They will not think about the like optometry after 12. They will start thinking about optometry from now only, and they will like start gathering like knowledge what like optometry really is. And the other like struggle in optometry is like people like when I have joined optometry, I used to tell everyone that I am like studying in optometry, and people used to ask me what optometry is. Like you have to like it's a struggle. Really, it is a struggle. So it will go up if only you can like share the knowledge to everyone.
सही है correct.
Sorry.
मेन का आपका क्या थॉट्स है?
हाँ, मुझे लगता है हम लोगों को ना बेसिक बहुत स्ट्रांग होना चाहिए, तो जो कि हम लोगों का नहीं होता है। मेरा तो नहीं था बेसिकली मैं गांधी आई से मेरा डिप्लोमा है, देन उसके बाद मैंने बैचलर किया, मास्टर्स किया। तो जहाँ पे मैंने इंटर के बाद हम लोग जब जस्ट कॉलेज में आए, तो पढ़ने वाला जो नहीं होता है बेसिकली कॉलेज में आते हैं। उसके बाद जब मैंने फील किया तो मैंने स्टडी स्टार्ट की, और मुझे लगता है जो बेसिक हम लोग पढ़ते हैं वही हमें आगे कंटिन्यू करता है। आज मैं एम्स में हूँ, तो हम लोगों को बेसिक स्ट्रॉन्ग रखना चाहिए, आई थिंक। देन
Great. So my next question will be like everyone is in your own specialty and own domain in optometry. So there are various specialties in optometry. I want to ask you why like Shashank is in like oculoplasty, Menka have something different into think in research and education, Ratna is in dispensing, and Prasenjita is in faculty, and so like what why you choose that one, like why not other specialty and all, like what encourage you to choose that one, and what other students can do there? We'll start with Menka.
मुझे लगता है कि हम लोग जब फर्स्ट ईयर में होते हैं तो बेसिकली हम लोग सभी पढ़ते हैं, डीसीज भी पढ़ते हैं, ऑप्टिक्स भी पढ़ते हैं, कॉन्टेक्ट लेंस भी पढ़ते हैं, एंड एवरीथिंग इज हम लोग को फर्स्ट ईयर में आइडिया हो जाता है। देन हम लोग सेकेंड ईयर में जाते हैं, उसमें हम लोग प्लान करते हैं मैं क्लिनिक ओपन करूंगा, देन मैं क्लिनिकल प्रैक्टिस करूंगा, देन नो ऑप्टिकल में ज्यादा पैसा ये मैं करना चाहूंगा, फिर कुछ मेकिंग लेंसेज, ये प्लानिंग थॉट्स आने लगते हैं हम लोगों को कि हम फ्यूचर में ये करने वाले। बट मुझे लगता है कि एक गोल सेट करना चाहिए कि मुझे इस प्रैक्टिस में जाना है, और उसके पर्पस से हमें आगे बढ़ना चाहिए स्टेप बाय स्टेप।
सही है। Ratna, your thoughts?
Yeah, my thought is like I have decided that I will go in dispensing only. So the thought like was successful. I went to dispensing only. So I have joined. So after my graduation only, I have joined in Lenskart. There I have worked like approximately for 2 years as a optometrist. Then I got an opportunity in Bangalore for Titan Eye Plus to join as a store manager. There I have joined like as a store manager and worked for 6 months, and the store was doing like 19 lakhs. Then I turned it to 24 lakhs. Then they have like offered me to handle 2 to 3 stores like at a time. So I have been like doing that also. So the thing what like want to tell everyone is like that there, as Menka like clearly said, that you have to like decide what you have to do. You cannot tell at a time that you want to go in opticals also, you want to go in hospitals also, that you cannot do together. So whatever is your goal, you have to like set it before only. So that will help you in future to decide. That's all.
Well, true. Shashank, what is your thoughts?
Yeah, to me, like why, first of all, like why I joined the oculistry is that it was very fascinating for me when I attended one of the physical conference. There I saw that there is some sort of artificial eye which we can prepare in orbital process. There I got some fascination. Then I have decided to join the oculistry module. So that was about me. What about the others, like whoever is doing an optometry right now, and what they have to do? What is my suggestion is that see you till 3 years, whatever the previous panelists have said is correct only. So you will be studying everything. So in the 3 years, in the 4 years, and by the end of the 4 year, you have to be in your mind like in which you are more interested actually. So wherever is your interest, much either it can be clinics, opticals, research, and anywhere. So you have to pursue that only, which will be more beneficial for you rather than searching for some money and some fancy things. I think so.
Understood. Want to ask one extra question to Ratna, that just wanted to know the this dispensing thing. People think that in dispensing, it is, I don't know, some extra mindset people have that if you go as an optometrist, there is not people doesn't respect and all those stuffs. So how you see that one, and what is your thoughts on that one? I also want to add what type of dispensing and what type of specialty dispensing, and what are the steps, and what better we can do in dispensing.
Yeah, that's a nice question, Apurvayan. The thing is, no, as you mentioned, that people have a thought that in clinic, or sorry, in opticals, that we will be more like evolved with the like optics only. So the thing, it's not true actually. In Bangalore, no, I have a friend like from Kolkata. So what she did, no, she now, if I'm comparing me and her, I was more involved in managing things. So I became a manager, and she was more like, she has been working with Titan like at 6 to 7 years. Now she is like she was not that much interested in managing, so she was being an optometrist only in the Titan showroom. Now what they did from Titan, they have like upgraded her. They have offered her to train the optometrists, whoever the newcomers are there in the companies. No, they have asked her to like train them. So it's not like that if you are coming to the like opticals, you will forget about optometry and you will not get the chance to you will not get the chance to sharpen your like knowledge. It's not true. Like you have to be true to yourself. Like if you have studied optometry for 4 years and after joining like opticals, you will like stop like reading or like stop studying about optometry. Obviously you will forget. Even in hospital also, if you are going and if you stop like studying, you will forget. So the thing is, if you are good at anything, you have to be sharpen your skills, then only you will get chance. That's the thing, Apurva.
Thank you, Ratna, for that. Next question, I want to ask that currently this AI and technology and other new things are coming, which are like game-changing things in optometry. This is an open question for all the panelists. How and like, what do you think? What will be the impact of AI and those like technologies in terms of optometry? Shashank, can we answer that?
Yeah, AI is now becoming a common thing in all. So it is going to be a very I think it is a very positive impact on the optometry. Like how it is affecting right now, like the diseases and all. So there are some forms, there are some softwares in which the patient can feed their symptoms and all, and the disease can come it like that. So there are few things like that, like similarly in teleoptometry, and the various things are coming into the way from the diagnostics to the treatment to the surgeries. Not surgery is not for the optometry, but from the diagnostics to the treatment, there are many things to come through. And similarly in our department also, in ocular history also, there are 3D printing is a major factor right now, which is coming.
Ratna, you have your thoughts?
Yeah, I don't think so. Like AI will like have some like much impact on optometry. I feel like if AI is coming, the things like it will take over the normal duties, so that optometrists or ophthalmologists, whoever are there, they can like opted for some better things. So in that case, but I am skeptical about the things that how good they will like take care of the patient's privacy and all. But rather than that, I think like it has a positive impact on optometry.
Wonderful. I want to add my own thoughts here. So currently I'm in the innovation of a team of LV Prasad here. So this is a personal thought I want to share because here we work with all engineers, designers, and all those people. And it is a extra great experience for me also. But yes, AI is impacting. Want to tell one more thing. In academy, Eye Supervision Academy, we take classes. In there, we are not doing only clinical things. We are also learning technology and what are the latest trends there. So I was also taking one of the sessions where I was teaching about the ChatGPT, how to use ChatGPT, how to leverage your LinkedIn and all, how to make connections and all those stuffs. So in academy, we also have all those stuffs. So want to tell that in AI, currently there are a few projects which LVPI is doing. So we are also doing something on like it has an impact. The impact is in not in terms of a clinician. So AI will definitely not take your role, but it will support you. So the main impact is like, see, I'm an optometrist. So with the help of AI, my work will be more easier. So if someone who is a very qualified optometrist and who is very knowledgeable clinician, they have to give some treatments and other like in optometry we have specialty treatments like ortho case, specialty contact lenses, and we also have vision therapy, low vision stuffs. This thing AI can't reach there. Okay, so the main thing what AI can help us is they can take in telemedicine. So that is a great thing in where AI can work with us, and which will be very helpful for optometrists. So one project which we are running in LVPI is we are doing a AI-based AI-based retinal imaging thing where we can understand the patient's diabetic retinopathy. So in the AI model, we have integrated 2 lakhs retinal images with diabetic retinopathy, with different type of diabetic retinopathy images. And so the machine has learned. So we give this to a non-clinician who never touched optometry or ophthalmology. They do a test. Just they will put on, maybe in a mobile phone, they will put on here, and they will take the images of retina. So there is something optics. We can take the image of retina by the dilation method. And by seeing that image, AI will tell that what type of diabetic retinopathy is this and what is the stage, what you need to do and all, everything it will tell. And it will also connect to the nearest ophthalmologist who is a retina specialist also. So there are so many things to do. And one more thing I want to add is like in telemedicine, it's a very good thing, AI. So if I'm here in Hyderabad, if some patient is in a rural area of Hyderabad or like a rural area of Telangana, where people can't reach, tier 4, 5 cities. So there, you can't say cities, village only. So there, if so, another project in LVPI which we're doing, we're making a drone slit lamp. So the drone slit lamp doesn't have an eyepiece. So if you don't have an eyepiece, so people will now question how you see through that eyepiece. So what we're doing is like, we are setting up a robot in the slit lamp. The slit lamp will be in the rural areas. So people will come over there, and I am staying in Hyderabad. I will have the iPad or the computer where I can select what type of illuminations I want to do. If I want to do fluorescent, I want to do anything filter, I have to do retro illumination, diffuse illumination, whatever thing I want to do, I'll just click on my iPad, and there it will automatically be taken. And the image will come as a 4K image, which I can diagnose and treat the patient. There we need one person who is just like not a non-clinician, just to guide the patient to keep the chin and rest the forehead. That's all. So many interesting things are coming. I want to encourage all the optometrists who are pursuing future optometrists. Please come in AI and please join in, like do something in AI related thing. And it is not that it's not only in LVPI's innovation, it is everywhere. So maybe it is also there in Ratna's Titan Eye Plus. There we can do 3D try-ons and all everything. So those AI comes in. So by seeing your face, what type of frame is suitable for you, AI can also tell. For round shape, we need a round shape face, we need a rectangle or square shape frame. So it will also suggest that one. So AI is playing a role everywhere. As Shashank also told that in oculoplasty, there is, we do 3D printing and all, we do custom prosthetic, everything. So it is also there. It's a like vast thing. If people want to learn, they can always welcome. So yeah, that was my like thoughts on that one. So next question which I want to ask is that how you like as an optometrist, how to get the like specialized practical knowledge during the studies, because this question arises because everyone can't study in the premium colleges of India like ESO, Shankar Netralaya, LVPI, then we have AIMS and all of those. We have BIS Pilani. So everyone can't study there. So what is the, like how a student can get those practical knowledges from college also, or from during their studies? The question is for everyone. Shashank, Ratna, anyone want to answer?
Okay.
Yeah, and
Okay, you can continue.
yeah, in that case, yeah, that is a serious problem. Even in my college also, in 4 years, in 3 years, we didn't get any like clinical exposure. So from the like for the pupils who are there from TIFS Agartala, so I can tell that it is a serious problem. So in that case, what I can like advise to like the people who don't have the exposure of clinical. So in that case, you can like speak with the ex-students, like ex-college people who are working in any of the like hospitals in your state only. So what you can do on Sunday, it is like Sunday is holiday, right? So in that case, Sunday you can visit any hospital and like you can go to the hospital and then you can like see what your seniors are doing. So in that case, I think it will like slightly help you to get the clinical exposure.
Correct. So Ratna is referring that if you want to learn, do a gate crash. So yeah, as an optometrist, if you want to visit your nearest hospital, you introduce yourself that you are an optometrist, so no one will deny you that you can't observe. So you don't touch those patients, you don't touch any instrument, but you can observe there. Yeah, it's a great thing.
And even for the pupils who are there from TIFS Agartala, if they want to go to Titan and Lenskart, they can like talk with me. I can manage that.
Definitely. Prasenjit, you were referring to.
Okay. So first of all, like during my college time also, and now I am a faculty. So the thing is that students are not aware and they are not habituated with the clinical practice. So as we know, after every student get a 15 days or 10 days gap for their semester breaks. So in this semester break, if they are want to go for any type of clinic like eye clinic, collaboration with the senior students or the senior faculty or any type of any ophthalmologist or doctor for the observation purpose also, from them they can correlate what they are studying in the current semester.
Your voice is breaking. Oh. Prasenjit, you are not audible.
Lost your saying,
Yeah.
like it's a holiday. So in the 15 days, you can talk.
Shashank, you want to add anything on that one?
Yeah, what I want to say is the question is that how the students can get a practical knowledge, right?
Yeah.
Yeah. So first of all, to get the practical knowledge, you have to be practically available at the point, right? So in the first of all, regarding the theory, so theory, so we can learn from the internet. Now it's a very good platform from YouTube, and most of the platforms are providing a very good knowledge. Okay, so which was not there previously, so that's a plus point. Second thing, to get a practical knowledge, you have to be available at the places like hospitals, opticals, and wherever you get the time, wherever is nearby to the students' home or whatever, they can go and reach there. They can contact them. So in the free time like that, I don't think so that classes are only from I think 9 to 3, 9 to 4, most of the places. So after that, they can approach to some hospital or like opticals, which I did actually when I was doing an optometry. And I tried in that way to learn some optical things in the short period of time. Actually, for 1 or 2 years, I tried that after my college. So that's they can do the first thing. Second thing, like now where there are various uh, conferences used to happen in which they used to give a practical knowledge. They can approach them whenever the conferences are happening nearby to them. And in their, I think so, there in the optometry, there are some vacations leaves also. At that time, they can join some hospitals and opticals, which where they can learn many new things, which they were only learning theoretically in their colleges, and that will be good for them actually when they will come out after 4 years or after 3 years. It will be good for them actually. I think so that they can try. Hello.
Sorry, am I audible? Hello.
Yes, audible.
Yeah. So yeah.
Was I audible or not?
Yes, you are audible.
Okay.
Okay. So yeah,
Actually, I think college should take a initiative that after the every semester you should do a summer training or winter training, and you should submit your like the certificate for a 15 days that you are visiting these clinics or for the observation purpose or for the learning purpose. So if it is mandatory from this every institute, so it will be beneficial for the students.
Correct.
If the students are not allowed to go, actually they think it's a holiday, but it's not a holiday actually. They have to work on it. They have to increase their skill.
Yeah, actually, it's a very right thing. Hospital has to try to do something, and wherever they are working, the colleges. But actually, it should be inside only the student only that they have to learn. Then only you will be able to learn. From my side to the students actually. If you don't want to learn, if you will only to submit the certificates and all, that will not being helpful to you in your long-term goals and all future. So you should be in your mind that you are doing an optometry, whatever you are doing, just you have to do from your heart. You have to try to be your best actually in that. So try to learn. So there are various platforms right now which was not being available, like Prasanjit Das. I think he was also did so many years of back. So the things were not available at that time, which are very much available right now, and there are vast scope of optometry right now who are doing it. So that's what I want to say. Apurban, you are muted actually.
Yeah, sorry. Okay, so sorry. So I'm just saying that. So we'll have few questions in the chat box as well as in the YouTube also. So before going to those questions, we'll slowly like come to the closing session of the panel discussion. So as we wrap up, we'll just wanted to ask the panelist, every panelist, like what are the messages you want to convey each of the students which are studying in first year, second year, third year, and into their internship in fourth year, especially for their journey into optometry. Any special messages? Prasenjit or Shashank or Ratna, anyone can take that question.
Yeah, I want to.
Yeah, please go ahead.
Yeah, the message will be like, see, you have like studying optometry, so your goal should be fixed. Like no, like other people's opinions cannot change your decision, like your aim. So aim should be straight. And the other thing is try to improve your skills. Suppose you are 1% yesterday, today you should be 2%, and tomorrow you should be 3%. So if you are knowing one thing yesterday, you should be knowing 2 things today, minimum. So that's how you will like improve your skills and like do good. That's all. And if anything is there, you can reach out to the seniors. We will be here to help you guys. You are muted.
What I want to say is that there is nothing a special message. It's just a very common thing which we have to try. So whatever you're learning, you just have to go. You have to learn the very basic things actually. So basic things you have, whatever you are learning, you just go into a deep of all the things. Then it will be very much of beneficial to you in the long run. Otherwise, if you will be keep learning, and because first year you will get something, second year you will get other thing, third year you will get, so you will keep on forgetting each and everything. But whatever you are trying to learn, maybe you can learn, maybe you are learning less, but learn in the deep actually, go to the depth of that, which is the only one thing which Menka has said previously, that we have to know the basics. Because most of the time what used to happen is that we are learning the very big of the things, but the basics we don't know actually. So we have to work on that only, which I think so.
Yeah, correct. Thank you. So we have few questions here in YouTube. We'll take that. Which specialty of optometry is more demanding in India? Shashank, you want to take that?
Most demanding is, I think so, it's contact lenses. It's a most demanding thing. It's an evergreen thing. Contact lenses, many of the people, most of the people whoever like in ITs and all want to use contact lenses. So it's a very common thing which we can say that most demanding, which I think so. Rest other panelists.
Yes, it's contact lenses also. And nowadays, as we are growing through the digital devices, every day we are using the different type of digital devices, as well as in the different meetings, class, the morning, from the beginning of our days to the end of the, like at the time of night, we are using everyday digital devices. So whenever we are using this type of devices, now convergence insufficiency also with their accommodative will sustain also with their accommodation problem, and the convergence problem is also with there. So BB also be you can think it's a career as an optometrist also, vision therapy, binocular vision also. So
yeah,
from
that's
my side also,
very good. Yeah, this is a very nice thing actually, because binocular vision and all things are very negligible right now, that doctors and most of the people doesn't know that when the patient used to come with the symptoms, we just diagnose with something else, or we send something to physicians for any headaches and all. But most of the time what I feel so is that har 4 mein se jo one person is suffering from some one type of a binocular vision anomalies, which and so there is a very good scope in that actually, if you will ask me.
Like I have seen that maximum of like optometrists and doctors, like if patient are suffering by the headache, they are giving the 0.5 of glass, or it may be the point of the migraine, but they are not roll out what is the actual things. I think people are not aware about that. There may be a convergence insufficiency, divergence axis, even also insustaining of accommodation. So I should aware about that also.
Correct. Anyone wants to add anything?
And there is a very good role of AI in that binocular vision also.
Yeah, that is great. Oh, so we there is a question in the chat box that someone have asked. Please discuss the challenges in AI system. So anyone want to take that? Or I can answer also. Sorry?
ভুলেই গেছি গো, আর সেমিনার ছিল 11টা থেকে স্টার্ট হয়ে গেছে, লাস্টে জয়েন।
Shashank, you are referring something. Okay, so I'll take that question from for myself only. The thing is that there are so many challenges in AI system, and also for the people for the clinicians as well as the ophthalmologist also. So in recent couple of meetings, I was just listening to the ophthalmologist. So they are also referring that like they are a bit of fear. Okay, it is not taking their surgical things, but it is coming into their space. So there is so with AI, what you can do, you can play with the data. And one more thing, so the data is king. Everyone, please note it down. So if you can document everything, every single thing, that is a very good thing. Currently, you are in colleges, document each and every individual you see. Maybe you can start doing from your home. You can start checking patients from your home. Maybe you take your relatives, neighbors, friends. Those are your first patients, because it cannot be like you pass optometry, go out and see some other patient. You have to be something for practice. You have to do at your home, and then you go out and see other patients. So as a student, you can do those things. And yeah, so I was coming to the AI. So few things in AI is like AI is not aware about the ethics, where the ethics will come in. So AI is not aware of that one. So there you need a clinicians for that one. So challenges are there. There is also challenges for AI too. So they will face few challenges. There is also one challenge for the continual learning. So see, optometry is a profession where things are updating every day. So just a simple example, I always give, there were 5 layers of cornea, now it's 6. So same thing. So like it is updating and all. So AI, so if you go to ChatGPT, it will tell that after 2021, I don't know anything. Before 2021, I have all the data. So AI have data till 2021. So what are the things happened in 2022 and 2023? They doesn't know. It might be something like there is a latest thing which have come maybe 1 month back or today also. So you as a clinician, you knows that one, but not AI doesn't know that one. So yeah. Anyone else want to answer, or we can move to the next question?
But collecting the data is very like maybe the easy thing for the AI actually. So because just that ChatGPT just came in the last year, in I think in November, December, and it knows all the things till 2021.
Yeah.
So, but yeah, so for the coming years, it is a very nice thing and positive impact for us also. But I think AI can take place so many of the things actually.
Correct.
Because it's just about the data.
Yeah, so it is like previously we have data, but we are not doing something. So it's like something with this new project which we have, which Google have also launched a few months back. There also the product is already out for Google. You do a fundus imaging, and it will tell what type of diabetic retinopathy it have. It also by like AI is so developed, like they can also tell the gender of the patient by seeing the retinal image. It is like very beautiful thing. And it is it is a growing thing in AI. If someone wants to come, that it's a very fast thing. But for that, you need to have some basic knowledges on AI and AI technical things, which is like coding and all those stuffs. So you should also understood that one. So we'll move to the next question, which is like, how do you manage difficult patient interaction or cases where there is no clear solution? Shashank?
I didn't get the question.
It is like, how do you manage difficult patient interaction or cases where there is no clear solution? So it was Shashank, am I audible? So it is like, how do you manage difficult patient interaction? It was asked by Paushali. So how you will manage different patient interaction or cases where there is no clear solution?
No, actually, it's not like that. There is no solution of anything. Actually, solution is obviously available for everything. But it's just a thing that we have to understand that somehow we can also not be correct in each and every time. So that's what I keep in my mind. So obviously there is a solution for each and everything. It's not like that. Difficult cases, so we can manage. Maybe it can also happen that maybe I'm not being able to manage, but I should keep in my mind, back of my mind, that there are things which may be Apurva and so I have to consult you, I have to talk on your, so these, in that way we can manage actually. So our main aim has to be clear in our mind first of all, I think so, that maybe most of the times I must not be knowing each and everything which my colleagues may be knowing, so I can approach them, I can call them, I can contact them, and even to the ophthalmologist also. In this way I used to manage actually, which is my personal experience.
Understood.
Exactly. Everything is not possible for for any of the human beings. So in that condition, you can consult with your seniors, or in a different type of groups also be there nowadays for the difficult case solutions. So like that also you can manage.
Understood. There are few questions which are for the next panel actually. So it is like they have asked question, what are the next steps and all. So basically it is for the next panelist. So whoever asks the questions, you will get the answer in the next panel discussion. So yeah. So that's all we have. Anything everyone want to add? So we'll wrap up the session here. Shashank, Ratna, Prasenjit. Unfortunately, Menaka is not there. So where she is, there is a bit of down of network in that area. So everyone is disconnected from the network. So last, anyone to add anything? So after that, we'll wrap up.
Actually, the thing is that in the clinical practice, you have to increase your knowledge and update your knowledge day by day, as everything is increasing, like updating. Even also in the smartphone also it is updating. Then why you stop your knowledge to updating? Is not it? So nowadays, every day, like updating the disease also, and treatment policy also be updating. So please update yourself for the student purpose. That's all for me.
Okay.
Updating is the only options.
Yeah, continue. Please proceed with that.
Yes, updating is the only one and only option to survive in the competition field, as well as to acquire more knowledge about the optometry field.
Thank you. Shashank, you were telling something?
What I want to say is again the very basic thing actually. See, so maybe many of the young optometrists who are just going on your first, second, third year, they may be listening to us, I think so. So there is no need to be worried about that. So people here came here, they were talking about something AI, some big contact lenses, some vision therapy and all. There's no need to worry about that. So first of all, whatever is in your hand is, so you, what are the basics, whatever the study you can do, best of the possible way from your heart, and keep doing that. And that was the thing, that was the key actually. So if you will be best in that, perfect in that, then only the other options will be open, and there are many much options which will be available to you in the coming years.
Understood. Understood. Thank you so much. I want to thank all the panelists who have joined, Shashank, Ratna, and Prasenjit Da. Thank you so much for giving your thoughts for all the students out here. So yeah, you can continue, or you can, if you have some work, you can leave also. Or you can also continue the session. So yeah, so we'll move next. So yeah, we are done with the panel 1 discussion. So next we have few. Okay. So can we have just a second? I'm just checking the schedule. Okay. Pooja, can we have your speech out here? So after that, we can continue with the panel discussion 2. So if you're ready with your speech, we'll start. Pooja, you are here? Yeah, so we'll continue with your speech.
Sorry.
Okay.
Okay. Sorry for that. Am I audible?
Yes, you're audible. Please go ahead.
Hello, everyone. Good afternoon. I have already given my brief introduction. So again, thank you for giving me this opportunity to talk here. I want to discuss about healthy diet for eye. People are often looking for natural ways to improve eye health. Whether it is through dietary choices or external remedies like castor oil for eyes. Those with a family history for poor vision or retinal health problems might fear that those with a family history of poor vision or retinal health problems that they are destined to encounter these problems at some point in their life. However, research shows that it's not all genetics. An individual diet can also impact their eye health. Certain nutrients and vitamins like omega-3 fatty acids, vitamins A and C, and zinc can lower the risk of prevalent eye conditions, including age-related macular degeneration and cataracts. A diet that includes whole foods containing eye and enhancing nutrients can help to ensure an individual is getting the nutrients that they need to maintain proper vision and eye health. These foods include antioxidant-rich citrus fruits, leafy greens containing phytochemicals, and oily fish that provides omega-3 fatty acids. So, while a healthy and nutrient-rich diet will promote eye health, eating highly processed and high-fat foods may increase the risk of eye problems. Other factors like diabetes and dehydration can lead to chronic vision and eye conditions. Vitamins and minerals may have the most beneficial to eye health. Lutein and zeaxanthin, essential fatty acids, vitamin C or ascorbic acid, zinc, vitamin E. The best foods for eye health and vision, those are fish, nuts and legumes, seeds, eggs, leafy green, etc. Other potential diet dangers to eye health include the following: diet soda, dehydration, diabetes, diabetic retinopathy, etc. In conclusion, an oil-balanced, healthy diet is necessary to maintain the overall health. However, a poor diet and junk food eating lifestyle can put your eyesight at risk. Healthy nutrients food is the key to minimizing the risk of developing eye diseases and infection. Thank you everyone for listening my speech with patience. Thank you.
Thank you, Pooja. Thank you, Pooja, for your speech. So now we will go ahead with our next panel discussion. So we have all the panelists out here. Just give me 1 minute. I'll just fix it up. Okay, so yes, so we are on to our next panel discussion. So here we are discussing about the role of optometrist in eye care and the perspective of World Sight Day in relevance to optometry. So we have our panelist, Dr. Ranadip Banerjee, who is the senior doctor of optometry and a private academico and clinical mentor. Sorry for that. Yeah, so he has done his bachelor's of optometry from All India Institute of Ophthalmic Sciences, and he have a vast knowledge in optometry. He's also known as the magician in optometry, and he has so many degrees. And also next we'll have Mr. Ghulam Muhammad. He's from Pakistan. He has done his bachelor of optometry, and after that he has completed his fellow of American Academy of Optometry. So next we have Miss Aksha Shetty. She's a PhD scholar and the ex-faculty of Goa Medical College. She is a very enthusiastic person. And next we have Mr. Nem Mahmood Russell from Bangladesh. He's a consultant optometrist and a visiting optometry for Dohar General Hospital and Lions Eye Institute, Bangladesh. He had done his master's in optometry from India, and he's also the member of the Bangladesh Academy of Optometry. Yeah, so we have our panelist. So maybe I have already given the introduction, so people also want to hear from you about yourself, what you're doing. So I'll start with Dr. Ranadip, sir.
Good afternoon, everyone. Good afternoon, Apurva.
Thank you.
Hope everyone is doing great. So you just wanted to know that what are we doing currently? Well, an optometrist does optometry. What else? The jokes apart, obviously we are working for the development of optometry in every field, like talking about the development from grassroots level, even going down to advancements in the field of optometry, innovations. That's my area. I like to invent things and innovate things for the betterment of the general public and their health and obviously eyesight. So that's what I am working on. And obviously, it's a great pleasure to be here and commemorating World Sight Day. But one question before we proceed. We celebrate World Sight Day, right? Only once a year. Does that mean that the remaining 364 days are like World Sightlessness days? If that is the thing, then I think it is better that we immediately pick up our kit, our retinoscope, ophthalmoscope and stuff and rush to our clinics, because a lot of work needs to be done, isn't it? So that every day in the year becomes World Sight Day. What's it?
Correct. Yeah, so next, Ghulam, are you here?
Yeah, sure. Thank you
Very
so
nice
much.
to meet you. I'm meeting you first time in person, like e-meeting you. Very nice to see you.
I am also very glad to meet you all here in this incredible event, and I am very delighted and thankful for the Eye Supervision Academy and all the management to invite me as occasion. And
Gulam, your voice is a bit down. Can you just check that?
Why celebrate? Uh, uh, is I am audible? Is it
Yeah,
clear now?
better.
2 days ago, I sent a message in my status and on social media. Indeed, social media play a very critical role in the development in the community and in the awareness, especially in the awareness of the eye care problems. But just by posting World Eye Day poster and all that, I share one story with them. I want to share here with you all too. I think a month ago, a 17-year child, female child, was presented to me in optometry clinic where her parents, and her main complaint was, chief complaint was decrease of vision. And in history, they revealed that she is suffering from decrease of vision since childhood. And she has 2 pair of glasses, out of which one was -18 diopter in both eyes, and the other one is -25 diopter. And still she was not able to see more than 660. Uncorrected visual acuity was counting finger at 2 feet. I assessed her and sent her for an OCT, and on the next 2 to 3 days after when she visited, I do her cycloplegic and slit lamp examination. And the more interesting thing is that her was from counting 9 and her was less than before, and basically compel her to leave her schooling. He due of her visual condition. She has her school in the 9th. Her parents, especially her mother, told me that never in 15 to 16 years anyone have guided us about the refractive index.
Sorry, Gulam, just wanted to tell that there is some network disturbance, I think. I don't know, I'm facing or others also. Can you please check that one? You are lagging, Gulam. Gulam, you are lagging. There is some network disturbance. Can you please check that?
Clear now? Is it clear now?
It is better, but in the middle of the if you're speaking is breaking. Maybe you just check that one. We'll just finish it off with Aksha and Mr. Nam. I'll come back to you then. So Aksha, how are you?
Hello. Hi. I'm doing well. How are you?
Really very well.
First, I would like to congratulate you and your team for putting up such great show. It is really
Thank you so
nice.
much.
I have been a part of this since the start, and I saw everyone performing, and I saw the speeches. Really good job. Uh, And for it to be the first event that you guys have organized, it's come out really well. Congratulations.
Thank you. Thank you so much.
And to provide a small introduction of me, I have done my bachelor's from Lotus College of Optometry, Mumbai. I then went ahead and did my master's from Chitkara University. And post that, now I am doing my PhD in biological sciences from BITS Palani, Goa division. And I'm also working as a clinical operations head at Kids Eye Project. So it's been a journey that way, but I majorly have been doing a lot of research in the past few years. Yes. And I also do writing work at the side. So I work as medical writer and content writer. I do a lot of freelance working. So yeah, that's a different side altogether, but I also do that a lot. Yeah.
Thank you. Thank you, Aksha. So, Mr. Nam, how are you?
Fine. Am I audible?
Yes, you're audible.
Hi, everybody. Mr. Ronald Banerjee. After a long time, we are in the same frame.
Absolutely.
How are you, sir?
I'm doing fine. How are you?
I'm also fine.
So see, it's a small world. We have the entire Indian subcontinent sitting right here, right now.
Correctly. In a one frame. So after a long time, mainly after the COVID time, this is the first meet in a frame. So very delightful program is going on. I'm joining from first. And whole program I am enjoying that as Mr. Apurvan arranged some cultural program also, and starting students which are now just started. Somebody I was looking that some students are very fascinating and some was very depressed, but I don't know why. This is the starting of their journey. So in starting time, if they're hopeless, so how can we grow in future? Okay, so there is nothing to worry about. Good days coming for us, and today is World Sight Week actually. They already passed. So I am thanks to Mr. Apurvan, Mr. Ranadev Banerjee, MS Aksha Shetty, and Mr. Ghulam Muhammad also. We're some discussing about that. Obviously, Mr. Ranadev Banerjee is a good speaker, good teacher, good mentor. Everything is on of them because I already
Why the gun is always on me?
yeah. No. You are also because and the other thing, Mr. Ranadev Banerjee is teacher of my teacher, Mr. Mundwakon. So it is a very pleased that I am a grand teacher getting to touch, and every time we getting him when we required them. So Mr. Apurvan, a special thanks for you because you just how you manage me and how you remember me. Just I am thinking about that after a lots of physical embodiment is here, and so okay, go on. Just I am short introduction. I am Mahmood Russell. I am just completed my master's in optometry from the Bhagat University in Punjab, and also I am a homeopathic physician and a registered physician of Bangladesh, and I am a treasurer of Bangladesh Academy of Optometry, which run by mainly in an online basis, but our main founder chairman, Professor Hassan Farid Sohrawardy, Mr. Ranadev Banerjee is known also, and we lots of time getting Kathy Easton ma'am, Dr. Kathy Easton ma'am. He was our foreign supervisor. So we learned a lot from them, and we are continue to learning and skill developing. Somehow AI is developing day by day. But I think a simple thing that no technology is work without human brain. So human brain is always the first. So many of the students, many of the faculties, many of the professional are going and being hopeless about the advancement of AI technology. But I think there is nothing to worry because AI could not be work without human brain. It required human brain to work properly. Okay, Thank you, Mr. Pupian. Continue your session. I am just participating with you. Not lots of scholar is here, so I am nothing in front of them. So just continue, and I am sharing and enjoying your event.
Good. Thank you so much. Thanks a lot. So, okay, we'll start with our first question. So, want to ask each of the panelists out here, like, what inspires you to be an optometrist? Why you become an optometrist? What is the first thought in your mind? It was by your own choice or by chance you came to optometry? What it was? And the second question will be, what is the role of an optometrist in eye care? We'll start with Dr. Ranadip Banerjee.
Okay. Pretty heavy question. Huh? Why in optometry and what about it? Let us look at it from a different perspective. Okay. I don't want to go with the convention that, okay, I cleared my 12th and then I started doing this, that. No, I will not go. Let us try to understand the concept of sight from a very different perspective. When you're a child, you're very frequently asked a question that what do you want to be when you grow up, isn't it? I'm pretty sure everyone has faced this question multiple times in their life. And every time we thought that we wanted to become something. Where did this thought come from? It came from our understanding of the world around us. That, okay, if you are in such a kind of a profession, this is going to be the perspective. This is how the masses around you, the society around you is going to conduct you. This is how you are going to achieve your dreams, etc., etc. Now, all these things, which gives a child the idea that I want to become XYZ when I grow up, comes from their understanding of the world around them. How do this with the eyes? So if you don't have the eyes, if you don't have its connection with the brain and the brain to understand and analyze the things around you, you cannot dream. Optometry is a profession which I consider is the only profession where you can command your dreams and make the dreams become a reality. Here you are the author of your own destiny, because more than 60% of the brain is associated with vision in some way or the other. Even for certain kinds of understanding, you close your eyes and you think about the most favorite food that you like. Immediately, an image comes in your mind of a plate with that food on top. No object is in front, no light is entering your eyes, and yet you get to see the image. So isn't vision a very fascinating thing? If it is, and you happen to be in such a profession that you can command that, you can change that at will and eventually transform lives, then definitely you don't need to look for anything else. Everything begins with vision. Vision comes through light. Light comes from the sun. The first thing that happens when you wake up in the morning is the entry of light in your eyes. So when you have that capability to harness that energy and transform the lives of millions of people around you, I consider it to be the best possible profession. So yes, a direct answer to your question is, I came to optometry by choice. Well-informed choice. I happened to get opportunities in other professions also. I was chosen as a scholarship student in IP Pavlov Medical College in Russia, which happened to be the rank 2 global ranking in terms of its ranking at that point of time for pursuing medical. I got chance in Queen Mary's Law College, London. By choice, I didn't join those places. I took to Optometry Institute. And I think if people look at my career track, I think I'm doing good. And I am innovating things which are going to help people in the upcoming generations to improve even further. So I'm just a small nut and bolt in this entire mechanism of optometry. That's how I see it. So if people think that, okay, optometry is a depressing profession, if they think that it doesn't have a future, I would definitely urge them to look at it from a different perspective and think again. Because this is a place where you can virtually do anything. Just you need to have the confidence, like an eagle. one of the king of the birds, as they say. Eagles don't take flight lessons from chicken. Neither do they flock with pigeons. The one that has the courage to fly high, solo, generally has the strongest wings and the willpower. And that is what an optometrist are. The commander of vision. If you look at a religious perspective per se, if you look at Christianity, the most populous religion in the world, Book of Genesis, part 1, verse 3 says, and God said, let there be light. And then there was light. But think of it from a different perspective. Light could be there, but could you have clear vision without an optometrist harnessing that light and focusing it on your phobia? No. So you share a very equal stage. You have the resources, you are the share, and you can create the best possible visual experience, which leads to 90% of the learning of a lifetime. Optometrists transform lives. That's all I have to say. Over to you.
Thank you so much. It was a really, very wonderful thought from you. So Gulam, can we have your talk on this?
Yeah, the journey of optometry is something that I will say that till my admission, I decided by myself. No one has proposed me that you should go for optometry. Definitely, I was going for another field, but unfortunately, at that time, due to some circumstances, I didn't get admission there. Further, I was offered admission on scholarship in biotechnology and biochemistry in a very well-renowned university, government sector university. But later on, I heard about optometry, and then I searched about the optometry, national and international standards of optometry, and the job description and the learning outcomes of the optometry. Then I decided by myself that I should go for optometry. And to be very honest, till the end of the my first year in optometry school, I was very unsure that what I am doing, where I have come. But anyhow, I passed my first year. Then in second year, I got more interest in optometry. And in third year, during my optometry school, I started applying for the fellowship of optometry. And at that time, I really, to be very honest, don't know about even the World FAAO. I saw the certificate, the degree of my one senior country fellow optometrist. Here I saw that he has the suffix FAAO. What does it mean? I started applying for that, and then during after graduation until now, I have published 2 optometry books, one on low vision and one on ocular pharmacology. But the most interesting thing is that the perspective and the value is not that of the field, that you have not done MBBS, you have not done the value and the demand is of the person, what potentials a person has. It is not the degree, it is not the any other. There are many businessmen who do not even go to school. They are metric fail, but they are very successful businessmen. So I think the scope is of the person, not of the degrees. And optometry is very interesting, and I am now very satisfied after my fellowship. I successfully completed my clinical investigator certificate, and I think at this time there are only 111 clinical investigators who are allowed to run. They are optometrists and are eligible to run a clinical trial as a principal investigator. I hope that all of here, especially Madam, she is a PhD scholar and know much. I am also currently part of phase 3 clinical trial and a biosimilar of Eylea for the wet AMD. This is a Swiss sponsored clinical trial. So optometry can give you more opportunities. The most interesting thing in optometry is that optometry has numerous multiple post-graduation options. You can go for MPhil, you can go for master, you can go till PhD, you can go for more than 10 to 15 fellowships programs in which you can specialize in a very specific, like in previous day, the most renowned contactologist visited India, and she is recognized for the contact lenses across the world. So in that sense, and there are more certain speciality in optometry, which only optometrists can do that. No one, either ophthalmologist, I will not say that ophthalmologist like low vision. In low vision cases, 90% ophthalmologists said nothing can be done. But still the low vision specialist will say there is some hope, we can do something for you, which create a ray of hope in the life of a patient to prevent them from their psychiatric issues and to give them a hope. So I think this is optometry. This is the beauty of optometry. Like I shared my story but unfortunately, due to interrupted internet connection, I missed it, that the child has left her schooling in grade 9 just because no one has guided her or her parents about her visual condition and the management option uh, for that specific condition. When she and after starting glasses refractive correction, they visited my clinic again after a week, and they were very happy, and they told me that we are planning to start our child school again. So I think this is very basic. And one last thing which I must say, that community approach awareness through different platforms about various visual condition is very necessary for an optometrist to prevent to play their role more critically in the eye care service. Thank you so much for the time. I will not take much time. And in the last, I am very happy to interact with most incredible panelists and speakers here from different countries, and I am very thankful to the Eye Care Supervision Academy, and especially Mr. Biswas, to you, that you give me the opportunity to join and meet here with all of you. Thank you so much.
Thank you so much, Gulam. Aksha, can we put some lights on this question on the role of optometrist and what inspired you to become an optometry?
First of all, thank you everyone. It's such a great panel to be in. I am so privileged. But I'll give a very conventional answer on why I got into optometry. Conventional answer being that when I was in 11th, I took up science, obviously, and I really loved biology. And I knew for sure that I did not want to get into MBBS because my perception at that moment was it was a very long and a very financially draining career to be in. And I did not want it to be, in that long journey. So I wanted something that would keep me in touch with healthcare, but also make the process a little smaller. And I remember having this talk with my uncle wherein he gave me a list of all the allied health courses. And I looked into the courses. I did a lot of deep diving. I spoke to a lot of friends of mine who were already pursuing certain courses like physiotherapy, occupational therapy. And then I kind of shortlisted on optometry. I remember going to Lotus College of Optometry when I was in 12th itself and speaking to, Prima Chande ma'am and kind of understanding optometry then. So yes, that is how I got into optometry. And how I got into research. was actually fourth year. So usually your college kind of really impacts on what you do later. So when you are in optometry for second, third, fourth year, there are certain subjects that kind of make you happy. There are certain, so it's not really about what is the trend at the moment. Like I remember there was a question in the last panel wherein they were asking what is the most popular field to take up after optometry. And frankly speaking, it does not really matter what is popular. What matters is what you are passionate about. So anything can be popular at the moment. I personally am not really, I'm not a very scholared person when it comes to contact lenses, but that doesn't mean I'm not practicing it. What I mean to say is it does not really what I mean to say is it doesn't really have to be what is popular. It has to be what I do passionate, and that you will understand only while you are doing the course. And I'm sure everyone will kind of figure it out by the end of the course. So you don't really have to do it at the moment. You can just go with the flow, kind of understand what you really like, and probably decide what you want to do. So research for me, so as Upper Bayan was also saying that AI, and we are talking about innovations at the moment. And how do innovations come in? They obviously come in with the question why. And the answer to how you derive to the question why is what is research. So if you do get into research and innovation is when you can develop things. And so research was what what I really like. So role of optometrist, when I talk in terms of at the current moment, there are, role of optometrist is so vast when it comes to eye health, public eye health, when it comes to comprehensive eye examinations at the start, when it comes to optical industry, when it comes to research and innovations, optometrists are everywhere. So it only comes down to how passionate you are about your career. I remember when I was faculty at GMC, the first year, the first full month when you start, when I started the course. So when I was teaching, so I used to teach geometrical optics in the first year. I remember the first month went in explaining what optometry is to the students. Because a lot of students who came into optometry were those who wanted to get into MBBS, couldn't get into MBBS, then tried for BDS, then tried for BMS, and then all those things, and then they landed up in allied health, and then they landed up in optometry. So what I want to emphasize here is know about what your career is, talk to your colleagues, talk to your seniors, and that is how you will know what opportunities are there in optometry. Like one of these panels, a panel is something really nice to be a part of, because when you understand what your colleagues are doing, what your seniors are doing at the moment, and it kind of puts light on what you can do and what kind of interests you. So when you're talking to the panel, I believe last panel had Ratna, who is into optical outlet. If you really like what she was saying, or if you really kind of connected with what she was saying, you would probably want to talk to her more and understand what optical outlet can give you, and so on and so forth. So yeah, I believe this is there are the role of optometrist in eye health is vast, and it just comes down to how passionate you are about your profession. Yeah, thank you.
Thank you so much, Aksha, for your thoughts. And okay, so Mr. Nem, can you brief on that one?
Yeah, it's a long journey. My choice of optometry that I first school secondary in 2002. Okay, but very early, some family problem, financial problem, I have to join. I had to join in a job very early of the age. My start career through a optical outlet. It's a chain shop in our country, very familiar. Joining there, short dispensing optician. It was operated by and funding by Orbis International, and that was established by State University of Bangladesh. So after I passed SSC 2002 and passed intermediate 2004 and joined to the job in 2006. Last 2006 2007, I started journey for dispensing optician, and after that, I feel it's a magic. So that means it's a. I feel that patients are paying money to see themselves. It's a very fascinating and also trying to develop in this field. So currently in Bangladesh, two institutes are operating optometry program. One is diploma in optometry and one is BSc in optometry, two divided university. But no council is formed here up to now for in optometry field. So in 2007, I felt I wanted a medical certification program. Certifications. So I joined to homeopathy, and for around 5 years, 2010 to 2015, I passed for homeopathy because to establish optometry, really, actually, and I completed then diploma in optometry and then BSc in optometry, and now just complete master's optometry. But in this full time, I worked in six God general hospital. I am working there, and then I joined the children in an eye hospital. In the working then COVID and we just managed Ranabir Banerjee was introduced us working on the online field. So I started my job career from optical net to eye hospital and general hospital. So in what?
Okay, I think we lost him due to less network connectivity. Okay, so just in the middle of the this panel, just trying to show there is some drawing has been done from one of the academy student. So just wanted to show that one.
Sorry, I was disconnected.
Yeah,
Now
yeah,
I'm
yeah.
audible.
Yes, you are audible. So please continue. After that, we'll have one drawing which we have got from one of our academy students. We'll show that one. So please continue, Mr.
Okay.
Naik. Yeah.
Okay. And then I worked in general hospital. So the pre-operative patient management, post-operative patient management, and some educating to the co-worker about the ophthalmology and optometry. What is the difference between them? So in first time in our country, optometry, role of optometry, that means what they do. If I describe in a short form, that optometrists work in a primary eye care clinic. They also a pre-ophthalmologist and uh, a type of surgeon. So see, he also remove foreign body from the eyes and also doing minor OT work, that means investigation related some work. And the secondary eye hospital, optometrist work only refraction and some investigation like SPT, IOP, and AScan and biometry only. In the tertiary level eye hospital, is a optometrist work different type of subspecialty, like they are a single division of from an optometry. Like they work about on the contact lens factor, or work in a vision therapy factor, and work on a low vision factor and pediatric optometry division. In a tertiary care eye hospital, it has a different sector for work in optometry. They also manage eye camp, and they also do a scan, D scan, and they also do fluid and also when operating in the country. In the other hand, out of this space, some optometrists work in optical outlets as a optometrist. They consult to patient, but in our country, optometry-based dispensing optician is not very popular. In our country, hospital-based optometry and optical outlet chamber-based optometrist is more familiar. They basically like to work in clinic, and comfortably they are working to there. So limited amount of optometrists and registered and graduate optometrists is limited in our country. So they are working in very well condition and earning so much. But nowadays, some of companies are trying to do different something about optometry in a dispensing role and a sales related role to employing the optometrist out of the clinic, because clinic is limited, but sales division is too much in our country. Like India, suppose India from India optometrists working in optical outlet in previous panel discussion. One member was Ratna Shah. He was a manager. So that is working in our Bangladesh. We are trying to develop them as a dispenser and also clinician, and also to reduce eye blindness and different type of programs. So in the on the other hand, the World Sight Day, what are we doing in our country? We're doing simply this year, we show that Optometric Society and Ophthalmologic Society work together something, and also government is supporting the Ophthalmological Society, because 200 more than 2 vision center is started in our country in Upajal Health Complex, health complex. So, but it's a frustrating fact. The worker who work or operate the ophthalmic instrument, they are only the out of the optometrist. So it is very depressing factor for us because their post or that position or that work environment is created for optometrists, but working ophthalmic nurse. So it's okay. We are also doing well. Government is highlighting day by day. And on the other hand, optometry education, I think it's a clinical, but some type of differentiate like therapeutic division. When low vision patient is going to totally blind, but optometrist can hopeful element to develop their lifestyle and to develop their vision. So I think optometrist or optometry based work and optometry based patient is developing day by day over the world, and we think we will become a bigger person and a bigger profession in future, because diabetic retinopathy, glaucoma, macular degeneration, including non-reversible eye or ophthalmic diseases are day by day increasing. So no will future. So only hope will be the optometrist. Okay, I think it's up to from my side, and continue, Mr. Apurvian, for your next slot. Thank you.
Apurva, if you can allow me just about a couple of minutes, just
Sure,
a few
sure.
points to add up to it here.
Sure.
See, when we talk about the profession across the globe, optometry is a uniform nomenclature. I mean, every person who is in the profession of optometry identifies themselves as an optometrist. But if you look at like different places within the country, abroad, around the globe, you will see that every different optometrist is practicing within a different scope of practice. There is no uniformity whatsoever. I mean, you will come across a lot of people who think that, just getting a reading out of an autorefractometer and doing a subjective completion of the refractive correction is optometry. And you will again find that there are other people who are talking fast about the subject and doing research and other things. Like any kind of wave, like when we talk about light as a wave, you will see that the wave goes up, stabilizes, comes down. The same thing happens with the profession. It's important to understand that optometry is a profession which should be a progressive profession. At the current state, within the subcontinent, if we look at how things are shaping up, with some exceptions, obviously, grossly, you will see that we are in a regressive state. Here, it's important that we look into certain timelines. I'm pretty sure that everyone is familiar with the name of Charles F. Prentice. We have read about the Prentice rule, we know about the calculation of prisms, etc. The same guy. You will be surprised to know that in the year 1895, Charles F. Prentice was threatened with jail. The reason behind was he charged for an eye examination. He examined someone's eyes, charged a professional consultancy charge for that, and he was almost thrown back to jail. Then why do you ask? How dare you ask? Prentice came back in the year 1896, just in 1 year's time, and formed the New York Society, which today stands as the American Optometric Association. That's how you slap back, that this is me. Naeem was talking about that optometrist doing A scan, B scan. I say the most important thing that an optometrist must say is I can. It's not about A scan or B scan, it's I can. When you have that attitude, that is when it will take you to 2020, wherein 5 states in the United States have been allowed laser interventions and 9 states have been allowed minor invasive surgeries using the scalpel even. That's where optometry stands in the world right now. So it's all about the attitude factor. Once you start developing, then there is a stagnation and you think that, okay, this is how we need to work. And then you think that, okay, all the books have been written and this is what we have to do. Either we assist or co-work with ophthalmologists or we work in the optical. So it's a very stagnating curve, which is going downstream. And eventually the dispensing opticians who are supposed to be serving the prescriptions of an optometrist starts employing them in some way or the other. So you see, instead of going up, it's going down. But when a thing comes down, it's very high time that it starts curving upwards again. So it's very important that we understand where optometry as a profession stands across the world and realize that where do we stand in contrast. If the contrast is very high, in that case, you have to reduce that contrast and get into an uniform illuminated state. So education is something that definitely needs to be taken into consideration, and application of what you have learned in that academics needs to be very important. I learned a lot about low vision, but I never practiced a single low vision in my lifetime. Doesn't help. So it's a more of a comprehensive approach towards the profession. And there is no cribbing that, this profession has nothing to give me. Unless you claim, no one is going to give you. There is no free meal in the world. So what happens is that it's very important that you understand where you stand, gain the knowledge, apply the knowledge, and show the world what you are capable of doing. That's optometry.
Thank you, sir, for your thoughts. Okay, so we have the Miss Suparna Mitra, who is have done this beautiful artwork. Suparna, if you are here, then you can explain about the drawing, what you've done. Are you here?
Good afternoon to respected faculty members and all present. I am Suparna Mitra. Currently, I am pursuing my Bachelor of Optometry degree from Tripura Institute of Paramedical Science. which is under the Tripura University. Our eyes are the most precious living gift of our life. So today I am representing the night vision show. As most of us visualize the night picture through there also a full and authentic view of the night. Therefore, I create a picture through which as we can experience that both scary and beautiful view of the night. Thank you so much.
Thank you, Suparna. It was a very beautiful artwork. Thank you so much for sharing. And I also want to share the links for quiz competition and essay writing competition is already shared in the chat. And if you also want to check it out from here, you can, you can scan this code for the quiz competition. And this is for the essay writing competition. You can take a snapshot and you can scan it. And also, so this is the quiz writing competition. And this is for the essay writing competition. The links are already there in the chat box. So we'll come back again in the panel discussion. So I also currently now want to ask that currently optometrists they're providing eye care in a global scale. So there are some challenges for the optometrist to do those works. So what are those challenges and how can they overcome those challenges? We'll start with Mr. Ghulam first.
As far as the challenges are concerned in optometry, so they are specific to each country and to each optometry organization. Like in Pakistan, we still do not have any government regulatory body for the optometry. And as far as I know, in India, in the past 2 to 3 years ago, an optometry council has been formed, which regulates the optometry body. And I think optometry is in allied health sciences. This is something very not interesting thing that optometry is considered in the Asian countries as a part of allied health sciences. Otherwise, optometry as an independent eye care profession, and optometrists are eye care practitioners. And if you see the basic and classic definition of the optometry, that they diagnose eye apart from the refraction, dispensing, and all those things, diagnose the disease of the eye and the rehabilitation of the visual system. And the visual system is up to the cortex and up to the brain. So the challenges are anywhere in the world. Like in past year, the Arkansas state of the United States denied very basic roles of the optometrist, and the optometrists there challenged that in the court. But at the same time, in many states of the United States, they allowed the optometrists to perform MIGs, micro invasive glaucoma surgeries. And if you look at the optometry practice in the United Kingdom, they allowed the optometrists to perform certain laser procedures. And if you look at the diplomat section of the American Academy of Optometry, so there are diplomats in glaucoma section, comprehensive eye care section, and uveitis inflammatory and infection section. So an optometrist performed very well, but there are certain limitations, there are certain obstacles, but they depends that whether the optometry in that particular country or region has a regulatory body or not. But otherwise, a universal definition of the optometry is very comprehensive, and optometrists can do or from major ocular surgeries, from surgery, further each and everything from the the comprehensive eye care, we deal with anything starting from the basics up to the brain. Like eye is eye is a window to the human soul, and optometrist can diagnose all those systemic manifestations too, like as a clinical optometrist. There was a patient suffering from pseudoxanthoma elasticum, and they were referred to us, and they and white streak in the eye, and then we refer them to the cardiovascular. And you look at that, an optometrist can manage and work along with other multi healthcare specialty. As far as the obligation and difficulties in optometry regarding the job description, so they are specifically related to the regulatory body and whether the optometry has a council or not in any country. So if an optometry organization has a specific regulatory body, they will definitely specify and streamline their job description and all what an optometrist can do.
Thank you, Ghulam. Aksha, what will be your points on this one?
So regarding what kind of barriers we face as eye health professionals, one of it is lack of resources, I would say. So there are so many institutes. So we were part of I came from an institute that was in a metro city, and I completely I know that when you are in certain divisions of India, so when you come from a metro city college, the kind of resources that you are provided with is not there in places that are at the very rural areas. So then there is a gap in between knowledge. So optometrists who come from certain institutes are obviously performing better because they are given opportunity to work in certain conditions. So yes, that is one of the major, I think, barriers that we face as eye health professionals. The next, another obviously a very major problem is recognition. Recognition, again, you are not recognized as a proper eye health professional in a lot of places. So yes, that are the major two I think barriers that an eye health professional, optometrist specifically, faces when it comes to providing eye care. So yeah, one major is obviously lack of resources at institutes.
True. Thank you. Mr. Nam, can you put some light on this?
Yes. So in this point, that some Asian countries are optometry regulated very interestingly, like Nepal, Sri Lanka, India, some of the state, and Pakistan also working very hard to develop optometric profession. Actually, it's a in my think in Bangladesh that lots of medical graduates are unemployed. Yeah, too much medical graduates are working very low cost value. So when we gone to the health authority, to establish the hospital or the eye hospital, they just put there only three basic rules. One is registration number for a medical graduate, and two nurse registration number, and three fourth class employee. That's it to establish the hospital. But only for eye hospital, or there are no regulation up to they are conducted. So for this reason, optometrists is not practicing independently, and there is no regulation is published or authorized from the authority. So I think, and some of the problem, there's a domestic institute and foreign institute education program is different. So which are passed from the domestic university or domestic institute and which are passed from foreign institute. So they are facing some clashes and they are underestimating to each to another. So for this reason, we are not going to unit and we are not become together. So less of togetherness, some of the assistant health worker taking the facility, extra facility, just like this year. At first I told that more than 200 government vision center are opened and going under the ophthalmic nurse, but they are not involved optometrist or ophthalmic medical practitioner. So it's a very hopeless fact for us because we they was contacted with us, but some of our students and some of our members, some of our association dominating only with them. So reasoning they are not fulfill the requirement, so they are deny us. So I think unity and skill development and advanced skill development is more required to develop our profession, and regulation required, but who will do this? It's a main question, because importance of optometrist, it is, we know, you know, some optometric professional know, but the general people or the general body did not know the importance of optometrist. So we think we need to work more to develop our profession, and mutualization with similar profession like physiotherapy or some sub medical therapy related activities. So we can do today and tomorrow get some regulation, because USA or England work more before more than 100 years ago. They are working, but we are not working properly independently in our country or Asian region mainly. But the crime or importance of optometrists is growing day by day, because lots of patients are coming to resolve their problem through optometrists, because doctors are busy to disease diagnosis and surgery. So accessories or others thing will do. So optometrist will be a very important part of human sight in future, I think. Okay, Mr. Murphy.
Thank you so much, Dr. Randeep. Sir, can you share your thoughts?
Okay, so when you're talking about challenges, have you ever come across any lens without aberration? I guess no. So aberrations are a part of optics. Likewise, challenges are a part of every profession, if we look at it in that way. The thing is, how far can you optimize your performance to cut down those aberrations? I very much agree with Mr. Ghulam, who said that it is more about that individual rather than the tag of that name of the profession over there. You will see even with other professions, and we generally tend to compare ourselves with the different medical doctors for that matter. So you can have a lot of doctors with medical qualifications, but then you will see that there are some doctors who are preferred more over the others because of their excellence in their activities, in their practice. So that is what gives them that recognition as to who they are. Let us talk about cardiology. The first name that would come in your mind is probably Dr. Devi Shetty, a pioneer in cardiology. Likewise, if you're looking at any different profession for that matter, you will have some icons who have proved their mettle. And that is when they have come to that, and then the awareness spreads. So if we stick to one particular area, grieving about our problems, that yes, we have identity crisis, people are not sure what kind of professional we are, people don't know what we can do, people don't know when to go to an optometrist, etc., etc., etc. I think that it is the responsibility of each individual within this trade, be it a student, be it a professional, be it a leader, that awareness through patient care needs to be spread, so that a certain community, let us say you live in a neighborhood where you have like around 50 houses around you. The question is whether the people living in those 50 houses know who you are and what you are. As to the nomenclature, I mean, by this time it has been made very clear that within India, optometry has been placed in the healthcare profession and not allied. So yes, we are a part of healthcare profession. But the thing is, one proverb is very well known to everyone, that a barking dog seldom bites. You know it, that if the dog is barking, it will not bite. I know it. But the question is, does the dog know it? That if it is barking, it should not be able to be biting. They don't. That means here sitting in a webinar, me, you, and everyone else can speak a lot about world sight day. We can talk a lot about developments in optometry. But unless these discussions get funneled down into the society, into the immediate community around, things are not going to change. So it's very important that each professional, each person who has entered this profession, even as a student, from the very first day of their studentship in optometry, should spread the word of optometry, that what it is, what do they do, and what they're capable of achieving to the immediate community. You are sitting in one place, 5 houses around you. If those 5 houses who have been, the members of those houses who have been seeing you since your school days, know you, they have a certain trust factor on you. Let them know what this profession is all about. Once you have that capability to practice, so those people should be your first patients, so that they get to know that after studying optometry, what is the scope. These 5 people are going to spread the word to another 3 each individually. If everyone starts doing this, eventually the entire country gets to know what we do. So I would never say that we should, hold ourselves back thinking about challenges. Rather, we should find the solutions to it and step forward. No war was ever won without a revolution. And that's where we should be heading to.
True. Thank you so much, Dr. Nudip sir. So, I want to ask one question that is for my own, the question is on behalf of my students who are there in academy. I face one issue, which is like, just wanted to share, and if anyone can tell me how I can resolve that one, it would be more better. So it's like I saw, so the students who are in academy, so those students are not from any premium institute of India. So they were like tier 3, tier 4 city institutes. So that is why they are in academy, so that they can those like practical exposures and all, because you get all those stuffs in the premium institutes. So one challenge what I saw is that there is some what you call it is like something like a restriction from the parents that whatever your college or school is teaching, that is only your area. You can't go outside from there. It like so they come to the experience center for their practical knowledge and all. They also attend the online lectures and all. So I see a restriction from the teachers that why you are attending that session. That is not your college session. Whatever your college will teach, that is your everything. They also don't let the student go outside to experience something. Like someone has also told that you can go any hospital or any clinic near to you, so that you can observe what are the things happening there. So I see a restriction over that. How can a student convince their parent is my question. To all, anyone can answer. Anyone is taking that question? Yeah.
Is it okay if I do? Yeah.
Sure.
Yeah. So I remember when I was teaching at GMC, I had some students who I used to say, at Lotus, we had this rule after second year, when you learn dispensing optics, you have to go for a 15-day internship and go to an optical outlet and practice for 15 days and get a certificate signed by the optometrist there, stating that you had come there and worked there for 15 days. And I wanted to implicate this practice on my students as well. So what I did was I did say that you have to go and do this work. What I believed was restriction from the parents. One of the major restrictions that came from parents was they did not understand why my kid has to go to an optical outlet when they are learning at a medical college. So major restrictions come at this end, wherein they don't really understand your profession better. So the one thing that I would suggest to all the students, and that is what I suggested my students also, was to explain their parents on what you do and what your professional scope is. Once you explain them your professional scope, and once you explain them why practical knowledge is important, they will understand. So that is one thing that I faced, and that is how I solved it. And again, it also depends upon the faculties, wherein they have to take the onus of if they are not able to provide such practical experiences at their institute, and if someone else is giving that experience to the students, it is upon them that they encourage the students to go ahead and get into that. Get that practical knowledge. I knew that I couldn't provide any practical knowledge when it came to dispensing at my institute. And I knew that that is very important. So, and that is why I pushed the students to do that. So that is one thing that obviously I believe when it comes down to students, it is important that you explain. So even my mother did not know what optometry was the whole first year, I believe. And because it's not something that they are, familiar with. So it's upon you that you take charge and explain your parents what scope you have in this profession. And then when you explain it to them, they'll kind of understand why you're doing certain internships, and it makes your life easier that way. Yeah.
Thank you so much. Anyone else want to answer that one?
I would take a easier route to the analogy. I mean, you were saying that there are restrictions from parents, right?
Yes.
The easiest thing that a student pursuing optometry can do, because understanding the fact that the parents are not optometrists or they are not from the profession, otherwise they wouldn't restrict, right?
Yeah.
They take a very easier route that when you were a school student, are you going just to the school and coming back and not taking any sort of tuitions anywhere? The easiest analogy. You are in most cases. Maybe you are weak in maths, you will go to a maths tutor. You're weak in chemistry or physics, you will go to a physics or chemistry tutor to get a better understanding of the same subject which is there in the books. That's one part. In this case, whatever you are going to do in your professional area of practice once you graduate is going to determine the entire earning of a lifetime. So learning the thing in depth is very important. Now, the parents would generally emphasize on the area that you have books. Why do you need to go to a profession? The cleanest answer is this, that books are a compilation of the entire knowledge. But books does not tell you how you speak with a patient. Books doesn't tell you how do you examine a patient, how do you touch a patient, etc. When you have a mentor who is going to give you a handheld guidance, or if you have a webinar where these things are being discussed among practicing professionals, that will enlighten you to such an extent that ultimately you gain the confidence to work without supervision. So here we are talking about eye supervision, but ultimately we are trying to reach a stage where you can examine the eye without the supervision. I think that is the best analogy that can be spoken to the parents, and they will in turn understand, because see, every parent at some point of time would become presbyopic. Let us assume they are emmetropic also, but at some point of time they are going to become presbyopic. So they have no other option but to visit an eye care professional to get their eyes corrected, right? And they have obviously seen that there is no senior or a superior standing beside the person who is refracting you when the refracting process is going on. So they are very familiar with the case that it's a single professional within a single clinic who is doing all this job. Now, if the child says that I am not confident about this and I need a bit of hand-holding, I think that is the easiest analogy what the parents can say, that okay, you go and you learn better so that you don't goof up in your business. Easy.
Thank you so much, Doctor. One live example I want to share. So there is one of the student who is in the executive committee of higher supervision. So like not there is a couple of students. They are in executive committee. They are managing. See, for me alone, I can't manage all those stuff. So some student have to come forward and they have to manage all those stuffs. Like they have to we also do camps and all. So before camp, you also need to take the trial box and all. You have to go there, all those stuffs. So maybe there will be some banner and also you have to take that one. So the challenge is the parents is like you're working for someone. It's like that one question, and another is like why you are there and you can't go there. Your college is teaching and all. Why you are going outside and doing those stuffs with some another organization? This is not good and all. So there is two students that they're also in the Zoom also. They want to know that how to convince their parents and is it a good thing by a student that I am a student? Can I also be in touch with the organization, not only iSupervision? Maybe there are also state optometry association who accept student memberships also, and student volunteers also. Can they go there and join if they want to do? See, they will also gain their own experience. They'll meet like a premium optometrist or ophthalmologist out here. So see, if someone were restricted to join this session also, it feels very sad that okay, there is a long 3-hour session, you can't join a whole day in Sunday. So few students missed. So few students missed this good panelists out here, Dr. Ranadev, Aksha, Naim, and Gullab. So if they come here, they are also able to see you. If they want to talk, they also able to talk you. So how to convince their parents is their question. Anyone want to take that?
Ask the parents to join along.
Yeah, that's what I told one of the students. So please, take your parents and ask them to join.
I think that is the best thing, that when the parents get a glimpse within the profession and they get to see that what kind of discussions are going on, and the topics sometimes are too bombastic that it goes above the level of their understanding or comprehension. They understand that something is going on. In this context, I remember one of the very famous comedians in Bengal. I'm just going to translate his very famous quote. He said that say such things which you don't understand yourself. So the person sitting in front of you would definitely not understand. The more they wouldn't understand, they will start valuing you that you have said something very high level that is beyond comprehension. So this is a statement from a very famous comedian, Anu Banerjee, in Bengal at one point of time. And to some extent, I consider it to be very true that when you bring people along and they see that there are like around 50, 60, 100,000 people joining up and having a discussion, or there is a very intricate interaction going on about certain things, certain pictures flashing up in presentations and other things, which none of those things are being understood by the parents. At least they get this understanding that, okay, this profession has something very difficult and it needs a lot of discussion. So they are not going to interfere any further. That sort of a thing will come.
Correct. Thank you so much.
Yes, I also agree with Mr. Ranadev sir, because we are working a lot in a difficult position. Sometimes we work overnight also. Okay, but we can't show our parents or our relatives that what are we doing there. So I also similar to Mr. Ranadev Banerjee and Mr. Aburbian, that parents can be invited in our CME program or our practical exam or our national council or international council or congress also, if possible. Then they will realize it's not a average profession, it's something different and a critical position, and it's required highly qualified, skilled and education, and also required a work friendly environment. And it's the physicians and the medical graduates or the professionalism are changing day by day, simultaneously according to the approach of the disease and diagnosis and the therapy division. So simple medical graduation is everything. I think it is not a uh, uh, single thing. So it's a changing day by day. And what are we doing? I need it's a time to expose to our guardian and our relatives that what are we doing as a lot. Thank you.
I'll just give a real-time example that I did. I mean, I just remembered this for one. It so happened that one of my students, okay, the same situation. They are coming to study in my own residential clinic and other things, and people have no clue because I am not associated with any institute. I am not any sort of authority of anything. Then why would someone come to me? And there was a lot of tussle that, okay, why would you go over there, your college, this, that, so many things. So I just gave that guy a very simple solution. He had a trial box, okay. And then the parents also said this, that see, I mean, giving power, I mean, this is the term that they use. They don't use the term refractive corrections or other things. Giving power is not that difficult. You have a box of lenses. They will be putting some lens in front of your eye. At one point, you are going to see clear, and that is what is being prescribed. This is the existing concept, even today, in most places. So what I asked that guy to do is that don't come to my clinic for a day or so, but you have your trial box. Why don't you open up the trial box, take off the spectacles of your parents, give them the trial frame and the entire trial box, and then ask them to try different combinations till they get to see clear. Right?
Correct.
Now, obviously, while trying after around 10-15 minutes with no progress at all, you know, those people are fed up. Then the answer comes that this is why I go over there to know in one shot what lens to do. And I think that does the job.
Correct. True. Thank you so much. Aksha and Gulam, anything you have to say?
Yeah, I remember in my college it was mandatory to when we have any practical exams. So it was mandatory that we bring someone from outside who did not know optometry to participate in the practical examination. So I remember once I took my mother. So it was contact lens exam, and I took my mother to be the patient. So they swapped patients. So I got someone else's patient, and my mom went to someone else. And I believe that is when she actually understood what I did. I'm saying this is the third year, and I obviously communicated with her well. But this is the time she understood what I did and how important it was of importance of what I did. Because ma'am was asking me questions and I have to respond. And she was looking at me at how I responded. So what I believe is one thing is, as sir said, that you give your parents, obviously not everyone has a trial set, but what you can do is obviously get them along and bring them to OPDs or show them what you do. Communication is very important, especially with guardians. It's important that you tell them what you do, and every day, like come home and share with them what you are learning every day. They kind of understand. They probably won't understand what you're saying and what you're learning, but it's important that you give them a glimpse of what your day was like, and so they kind of get into the loop and try to understand what you're doing, and that kind of bridges the gap, frankly. And you can't blame them. They have never been exposed to such field. It's difficult for them to comprehend of what you're doing. Imagine my mother only understood that the third year, the importance of what I was doing. So it does take time, but obviously she knew what I was doing because I used to communicate every day with her. Like, आज मैंने ये सीखा, आज मैंने ये पढ़ा, आज ये सिखाया गया. It's very important that you come home and communicate with your parents, because even if they don't understand, they kind of know, अच्छा पढ़ रही है बेटी, पढ़ रही है. So yeah, that is something that kind of helps. Sure.
Thank you. It's really, really good thoughts. Gulam, anything you have to say? Any challenges you faced? And what you can share, like what can be done for those restrictions? Gulam,
really hypertension my grandma is audible.
Little bit. Can you?
Is
come
I'm
again?
audible?
Yeah. Now it's fine. Great.
Now it's fine.
Yeah, it's fine. Please. Go ahead. Hello.
Always to me and
Ghulam, I think we can't hear you. Okay, maybe he's some network issues. Okay, so yeah, thank you for all those thought. So I want to introduce Mr. Samrat Shah, who is the victim. Now he's also here. Yeah, Samrat, can you please turn in your camera and mic also? Can you please also speak up your experience, if it is possible? And today also he was managing all this thing back end, and he was like, okay, I was hearing his parent was like, hey, what you were doing and all, Sunday morning. So he's one of the victims. There are so many other victims also.
So a very good afternoon to all the dignitaries present over here. It was very much thankful session for me because I could get a chance to listen to such renowned persons from our field across the world. So as Mr. Apurvan has said that, yeah, I'm the victim. Among the students, I was the very first victim because what happened, being a student right now, I am also the general manager of iSupervision, and I handle the iSupervision Foundation and all such staffs in the means whatever is going on in the iSupervision, I handle and just look over the things. So what happened, after coming from the college, I get busy with the things and all. So when my parents just see the things, they just tell me that run under the thing that's benefit for you. But I am unable to explain that, yeah, this thing is also a beneficiary for me, but because yeah, they are not that much what to say, knowledgeable persons, so they are unable to understand. And so some of us, I think three of us are facing very much problems regarding this, that they are thinking that, yeah, we are just working under a person and he is just making us work for his benefit, not for our benefit. They are seeing that we are working under him, but not for our benefit, and we are learning, we are something a step ahead from the other students. So that's the thing.
Thank you so much. I want to introduce yourself because you was the active member and also the handling so many stuffs after all those complications from the family. That's why I want to introduce yourself to Dr. Ranadev sir, Mr. Nam, Ms. Aksha Shetty also, and sorry, Ghulam is not here. So yeah, thank you, Samrat.
Probably Apur Bhayan can hold a open house for all your parents to come in, and then he can explain what he actually does. I believe that will be a good idea, no?
Yeah, I already met his parents. So it's like, I understand there it's a like thinking issue. He comes from a business family background. So after seeing my degree MBA, they're like, okay, he's MBA, so he's doing business. So
no, I mean, look at him. I mean, he can definitely convince his parents by saying one thing for sure. Let's see, I have studied optometry or whatever. But what is your age right now, Samrat?
So I'm 21 right now.
You're 21 and you're the general manager of an organization. Come on, people spend years to get to that position, isn't it? Bro, hai bhai. So it's good. You can obviously tell your parents that, see, I am learning and I am observing. You know, the day I think I can beat him, I will open up another organization. Trust me, you can tell that. What you do in reality is known to all of us. See, we are like more of a fraternity. I hate to use the term community because whenever we try to like break down the word community, it seems like unity. So we are anyway lacking unity a lot, right? So I wouldn't use the term unity, but rather it's a fraternity. So everyone is watching after everyone's back, and that's the support that we need to build in. So just show the rosy picture to your parents. That's it. But congratulations on whatever you're doing.
Thank you so much, sir.
Okay, so we are coming to an end of this session. So yeah, so maybe can we take few questions last from the chat box? Could you discuss most challenging eye condition to diagnose and treat, and how optometrists stay up to date with advancement in managing these conditions? Okay, anyone want to take that? Most challenging eye conditions to diagnose and treat, and how optometrists stay up to date with the advancement in managing these conditions.
Yeah, which type of disease is want to say? There too much complication or complex disease can be established or find we can, but which perspective or which part of disease we want to know? Any additional?
No, just got this question. What are the challenges eye condition to diagnose and treat, and how optometrists stay up to date with the advancement in managing these conditions?
I think it's incomplete question because he has to know that which part. It can be a corneal ulcer, it can be a uveitis, it can be a cataract, it can be a vitreous hemorrhage, it can be a retinal hemorrhage. So which part he want in a, also it can be a traumatic case. So he has to clear that which part is in a traumatic case or in a chronic disease case or in a sudden drop of vision. He has to clear, and then we can prescribe him that or her which part we can do and which part we can do not.
True. Yeah, I think we have an interesting question. As we are studying optometry now.
I believe it depends upon how knowledgeable you are. No, some people also make mistakes in finding refractive errors. So it depends upon how knowledgeable you are. So it doesn't really matter what is most difficult. But the second part of the question was really nice. How do you stay up to date? Let us solve that part. So how do you stay up to date is obviously you attend good conferences. You CMEs is very important when it comes to any form of healthcare industry. So CMEs is continuing medical education. So any form of CMEs that you kind of interests you, you have to attend. You have to talk to your seniors. You have to stay connected. Social media, especially nowadays, such a big boon to everyone. Stay connected through social medias. LinkedIn is such a great platform, such a big platform. Utilize LinkedIn. I believe I met you also on LinkedIn. So it's so important. You meet people on LinkedIn. So LinkedIn is important. Connection is important. And read papers. Evidence-based practice is here and it is going to stay for a very long time. So you need to know researches. You need to know what's currently happening all around the world. And that is how you stay up to date. And that is how you improve your practice, because whatever you see, whatever you read, and whatever you learn at these CMEs is what you apply in real life. So yeah, this is how you go about. And there's nothing, as Sir also said right now, it depends upon what part you're talking. But also it depends upon how well learned you are. So if you are a well learned person, you won't find difficulties when diagnosing. And you won't find difficulty in referral system also. It all comes down to how well learned you are. So yeah. Sorry, I interrupted you, but I just wanted to answer the second part of it.
I also as Naeem said and Akshay said that, see, the question itself was a bit tricky, but yes, other than the conventional diseases and disorders that we talk about, I personally consider that any oculovisual condition which is linked with the psychology of vision are the trickiest ones to diagnose and manage. Because when you see that the structure is fine, functionally things are fine, but the moment your brain starts playing tricks on that, everything goes for a toss. So underlying psychological issues are the toughest to diagnose per amount. And then definitely how you manage that. Because not all sorts of management of those conditions are essentially of an optical or a medical nature. A lot of it takes into a lot of counseling, a psychological treatment of that patient, which is essentially talking with that patient in most cases. So how do you stay up to date? You read books, read journals, interact with people for sure, but then try to think out of the box. And at the same time, practice thinking and analyzing in your own mind. That will strengthen your own brain so that you can easily differential diagnosis and manage all these cases, even with some novel ideas which no one has thought before. I mean, I always say one thing, that even if you consider, the genius Arvind Borish writing the gospel of optometry, that is a compilation of what he considered optometry, what he learned. It's not that that is the final word being said. Tomorrow, a student can come up being an optometrist, get some new experience, think out something new, and then they can add on pages to the same book. So research is ongoing. How does it happen? You think what people have not thought previously. And then there's no shame on it. That, okay, it's not written anywhere. You write it. Who is stopping you? So psychological impacts on vision and thinking outside the box with further in-depth own analyzing, practicing thinking is very important. How you learn and update at the same time. I hope people will agree with me.
Out of the topic, I want to say one thing, that one difficult situation, or when you will observe a patient, it's a very simple thing, but psychologically, if you don't be able to prove them that it's a simple thing, it make a very hazard situation. And one thing, in a difficult case, can be a thousands, I think more than a thousands of books, achieved education. Can we learn you? Can we teach you also? And recently, I just not show, but still something about a case study, simple, for 45 days ago. I just observed a patient, he is sudden drop of vision, and I observed that he is suffering from severe diabetic non-proliferative diabetic retinopathy severely, and vision comes to less than 3 feet. Less than 3 feet finger count. And then I have told them that it's a non-reversible disease. It cannot be curable. It can just manage, but your vision should not be increased. It's a time. But he deny my opinion, and deny my everything, and goes to a eye institute, and after 45 days, lots of things they have done. They done intraocular injection. They done different type of test. They done some type of surgery. After 45 days, vision is not improving, and so, he with relatives come with my chamber and my office, and told me that he was still correct, that it was not reversible. So it's a time that sometimes some of patients are facing or creating some critical situation, but they can't believe that we can do something, and we are too highly skilled person. So after a long duration, and after expense too much money and time, they believe that we have something to do about true.
Thank you so much. We'll take the last question here from Swarna Sarkar. As we are studying optometry now, is it a good idea if we do another course after pursuing P-Optom, like it advantageous for us or not? If it is, then which one is better? Maybe she's referring to courses which are non-optometric. Yeah.
Yeah, I mean, you are doing MBA, so that's not optometric. Yeah. So, yeah, there are so many things. Like, I'm not doing my PhD in optometry, I'm doing it in biological sciences. And I mean, a part of it is in related to vision science. But I've obviously expanded my field. That doesn't mean I'm leaving the roots of it. But what I mean is, it all comes down to what you want to do in life. So, I am assuming that you want to get into management side of it, and that is why you're doing MBA and did not go ahead and pursue your M-Optom or in that course. So yeah, I mean, there are a lot of options. A lot of my friends have also gone up and done masters in public health. Some have got into hospital management. Some have got into marketing. Some have gone in, there are so many things that you can do. And still not leave the roots of it. So you can't, so as he's also done his MBA, but he's not leaving optometry. I'm assuming he's still stuck to optometry. I'm also not planning on leaving optometry anytime, but it kind of broadens my view. So I am not only doing optometry, it broadens my view to different segments of biology. So yeah, it's not really bad to, I believe, not bad to, explore, and not bad to kind of learn what you want to do. It all comes down to what you are interested in and what is your passion, what you kind of understand. And frankly speaking, you'll understand it in the 4-year course of your optometry. And if not in 4 years, you'll understand once you start working on what you want to really pursue. And there are so many options now open, so many options that you can obviously, kind of funnel it down and select one of it. So yeah, I believe it's not really wrong. It's perfectly all right and perfectly nice to, explore and get into different fields. It kind of broadens your knowledge. It also gives you a new perspective, and it also adds on to your skills. So you're already an optometrist and it's all adding on to it. So yeah, it's perfectly great. Explore, talk to your colleagues, talk to your senior, or talk to people who are already doing it. It's great. You are on mute. You're on mute.
Okay, sorry. So fine. I think we're done. Mr. Nam and Dr. Ranadev, sir, can you would you like to tell anything on this, or Mr. Gulam?
There is a person known as Mr. Shrikant Jekar in India,
okay,
who holds 20 degrees from 42 universities and is known as the most educated man in India. He is in the Limca Book of Records as well, right? Prior to this, if I'm not mistaken, I think I heard about Dr. B.R. Ambedkar, who held 32 degrees. So, I don't find anything wrong with enhancing your education in any way. The more you know, the more you know which weapon from your arsenal you need to pull out and do things. So what to do, how to do, that totally depends on what you want to do. The most common thing that you will hear school children, when you ask them that, what are the things you like to do? They'll say, I would like to play games, this, that, so many things. What you don't like to do? I don't like to study. Now, in this case, I would like to definitely congratulate her that she wants to know what she wants to study, right? So she can definitely study, first of all, on that thing, that what are the things which can add on value to what she is currently studying. That itself is a study. So why not?
Gulam, you were telling something.
Sorry, why addition I didn't get your question. Can you repeat the question?
So I was telling that,
can I know the question?
Sorry. I was just
We'll answer a question
yeah,
later.
yeah. So I was just
Telling that
asking that
you
after pursuing optometry, like is it advantageous to do other courses which is non-optometric?
so it is according to my perspective, it is totally dependent on the personal interest. Like many of the optometrists goes for public health, PH, and in business administration. So many of optometrists doing well in European and the United States. Also pursuing their MBA degree, and the optometry has various branches like retail optometry and business optometry, and it's my knowledge. One should my or second thing, it is all about interest of anyone. If anyone has a particular interest, reality in any other field, we go for that. And but I think that if anyone once have decided that I have to do my graduation in optometry, so I personally think he must not have graduation too. After graduation option, there are a lot of options after graduation in optometry too. And one can do master MPhil, one can do different fellowship, one can do PhD and in research. So anyone wants to know what is that regarding.
Yeah. Your voice is breaking, but I understood few things. Thank you, Gulam, for your thoughts. Mr. Nam, anything last you want to tell?
Yes, I want to say something that it's a Bachelor in Optometry is a general graduation program. So after that, you can do any economical or health-related program to enhance your knowledge or development knowledge. But on the other thing, on the other hand, I think that you need the business sense because out of business sense, you can extend your knowledge or your boundary. Okay, so it can be academic or can be non-academic. Okay, but so after complete the BSc program, then anyone can achieve MBA or anyone can achieve post-graduation to the relevant field, or can be PhD, or can job to make a job to not it out of this relation organization. Just in our country, some days we're seeing that a medical graduates working as a manager of bank. So how they do this? I am confused that. It's a BSc engineering from a reputed university in Bangladesh. He is promoted as a public service commission and become an superintendent of police. Yeah, so I think there is no limitation of imagination. We can go aggressively, progressively towards our way, and time will decide that which is right or wrong. And Askar Shetty more time says that, and also Ratna Shah says that goal is important. How long you want to go, then the road will be open. Yeah, that's it.
Thank you so much. Thank you so much. So we'll come to the end, and yeah, we'll finish it up, wrap it up here. So yeah, thank you so much everyone for joining and giving your wonderful thoughts. It's been so helpful for me as well as all the students who have joined here and who are also in YouTube live. So thank you, Dr. Ranadip Banerjee sir. Like your thoughts were very interesting and all. And also I want to like invite all 4 panelists for the visiting for do a visiting lecture for any of the topic for academy any time of your choice, so that we can make our academy more quality better. Yeah, thank you, Mr. Naim, for your thoughts also. Thanks, Aksha. And thank you, Gulam, for joining all the way from Dubai. Thank you so much. Thank you so much, everyone.
Thank you. My pleasure.
Thank you. Thank you for
Yeah,
calling. Thanks.
fine. Thank
Thank
you.
you,
We'll
everybody. We'll
yeah,
see again in a new
sure.
program, a new
Yeah,
platform.
definitely. Definitely. Thank you so much.
Thank
Bye.
you so much. Thank
Yeah.
you so much. Thank you.
Thank you.